deters people from talking about politics and discussing issues of disagreement. However, as we all know, we have civil ways to debate things, and that's why we're all here tonight. So I'm very, very excited to have you all joining us. I first wish to thank Doug Spry, Director of Multimedia and Campus Partnerships, who is also the Director of Braver Angels College Debates Program, for allowing this opportunity to take place here tonight. Doug, along with the rest of the Braver Angels team, has been an invaluable partner. We are really, really excited to participate in any efforts that are aimed at increasing civic engagement, and we are looking forward to our discussion here tonight. And with that, I will now introduce Todd Lassa. He is the founding editor of The Hustings, to explain how this conversation will transcend past this discussion here this evening. Todd?
Thanks, Jessica. The Hustings is proud to be a sponsor of the Allegany County Day of Civility's debate on healthcare. Like Braver Angels, the Hustings.News seeks to foster civil discourse between people of various political persuasions. We offer left and right comments surrounding a column of straight political news all on the same page. So please go to the Hustings.News Friday for a summary and review of tonight's debate, and email your comments to on the subject of healthcare to the email address below, editors@thehustings.news. And on the weekend, we will post your comments in the left or right column, depending on where they belong. And now it's my pleasure to introduce Renee Mason, the Arts and Graphics Coordinator at the Allegany County Library System and Library Representative of Choose Civility, the Allegany County chapter. Renee?
Todd, you can unshare your screen.
Renee?
Thank you, Todd. Hold on. Yes, like you said, I am the Arts and Graphics Coordinator for the Allegany County Library System. And with Choose Civility, it is a grassroots initiative to improve and enrich Allegany County by promoting civil conversations and kindness towards others. Today, we celebrate our 4th annual Day of Civility, which is where we focus on spreading kindness, building understanding, and strengthening civility throughout the community. We often have cross-college dialogues, which incorporate the principles of civility found in P.M. Forney's book, Choosing Civility. We recognize that our success in keeping our chapter buzzing with activity is due to our partners, like the City of Cumberland. On Tuesday, the mayor read the City of Cumberland's Day of Civility proclamation. So thank you to the mayor, and I introduce you to Mayor Ray Morris.
Thank you, Renee. It's a pleasure to be able to join you all tonight and be a part of this discussion. You know, I probably should have brought the proclamation and read it, but you all probably didn't want me to spend that much time talking, to be quite frank about it. But I'm really looking forward to this, and I thank you so much for allowing me to participate in this event. I think this is the type of event that helps people have a good discussion about a topic and get different perspectives on what people believe is the right thing to do in this case.
Hey, I think I'm going to jump in here next. I'm Dr. Elisha Rominsky from Frostburg State University, and I welcome you all to this event. I am so happy to work with all our partners who are in this effort together, Jessica and Doug, Todd, and Diane, Renee. I mean, the list goes on, and we are glad you're part of this list too. And I'm going to introduce Dr. Mike Mathias, who is our interim provost at Frostburg State University, who has been supportive of civic engagement efforts. And we need these, to expand from campus out to community and back to campus. So we're glad you're part of this experience. Dr. Mathias?
Thanks very much, Dr. Ominski, and good evening, everybody, and welcome to what I'm sure is going to be a very engaging debate on an important social and political issue. Thanks to all of the organizers of tonight's program and all of the events associated with the Day of Civility. These events really reflect, as Renee said, the strength of the partnerships that unite and define us as a community. So again, I really appreciate everybody turning out and hope you'll all be active participants in tonight's conversation. Thanks again.
Diane?
Okay, I'm going to jump in. Thanks, Alicia. I am so excited to be here. There are so many people on this call that I know from class, and I just got to meet because we're doing this wonderful event together. It's such a collaborative, kind of synergizing experience. And I hope that it'll be a way for everybody to know that you can be a leader in the community and that your voice is important. What you have to say is very important. So please take this opportunity tonight to speak, to let your voice be heard, to say what's important to you, and let us hear your perspective and be open to hearing what other people have to say. And I'd like to introduce Dr. Kurt Hoffman, who is the Senior Vice President at Allegany College of Maryland. He's a very big civic engagement advocate. He's my role model, and I'd love for him to say a few words.
Hello, folks. I'm incredibly encouraged by seeing how many faces are here. And I'm thinking of the students in particular, because we know from the research that students don't like the discourse that's going on in politics today. The incivility of all of it is a turnoff for them, but they're very interested in civic engagement. So I think tonight is going to show you that civil discourse can happen when it comes to politics, and the idea of kind of a deliberative dialogue in which you deliberate, you think about, you weigh options, you weigh the other side, and then dialogue, which is, through knowing together, that we can have this communication that isn't who is the loudest, who can shout the other person down, but can we create this collective knowing together, which is community building. So I'm encouraged about what you guys have in front of you today. So welcome.
Thank you. We're going to turn it back to Doug Spry then, the director of Braver Angels College Debates.
Okay, everyone, can you hear me?
Yep.
I want to thank all of our sponsors and organizers for helping us put this together. It's unusual to open up a debate with so many people from the community and the different colleges and leaders in Allegany County, and this is a really fantastic night. It's still been driven by students, and they're at the nucleus of the whole thing. My name is Doug Spry. I'm with the American Council of Trustees and Alumni in Washington, D.C., ACTA, and we are a major partner with Braver Angels and the student group Bridge USA in organizing a whole program of college debates just like this all over the United States. We are really delighted to partner with the folks in Allegany County and Frostburg State to host this collegiate/community debate. I'm going to try to move fast in my introduction. For the next few minutes, you can call me Doug, but when our debate begins, you'll call me Mr. Chair. And I'm going to invite you into a special kind of conversation in which everyone participates, as many of you as possible. Braver Angels debates are different than other debates. And we have people to whip. When you mute all, you mute me as well, just so you know. A Braver Angels debate is something that we want to be very different from what we saw last year, at the end of last year, in the contentious presidential debates on television. We're going for a very different dynamic. We're bringing lots of respect and deep listening and no interruptions or criticism of each other. Now I'm going to extend my usual introduction by just about 30 seconds. I want to show you something, because this is in a way why I came to Braver Angels. This is the year 2010. And this is in Reston, Virginia, at a healthcare town hall. That's what it was billed as. I thought it would be exciting to attend one of my first ever civic events about a topic that, you know, as the Affordable Care Act was starting to really surge in the public mentality with the Obama administration. And so a town hall was called, as it was, the same thing was being done all over the country. And I showed up to my daughter's high school, which usually the gymnasium holds about 600 people. 3,000 people showed up. And I never experienced anything in my life. It was bedlam. People were shouting over each other. They were waving signs. They were demonstrating, and as all Americans have the right to do. But it was really one of the most uncivil things I've ever experienced. There was, you know, people had to be dragged out by the police. The people up on the stage, the legislators and the Congress people from both parties who came to have what they hoped would be a town hall respecting all viewpoints, were shouted down. And, you know, I just was stunned by this. And fast forward to 2018, when I met David Blankenhorn of Braver Angels, formerly known as Better Angels, and he explained what this program was all about. My heart began to dance, and I knew that this was something that I wanted to be part of. An organization that brings people together in dialogue where they respect each other's views. And that's what we're doing tonight. This debate is not a shout down, and it's not a competition. There's no winners or losers. It's a collective search for truth as we bring our views together around a challenging topic or question. We're celebrating diversity of thought here. So our number one ask, my number one ask, is say what you believe. Speak from your heart as well as your mind. There's no need to be eloquent. Just be yourself, and sharing your own personal stories is encouraged as you express your view. We assume that everyone here is coming from a place of good faith and positive intent. And lastly, let's have fun tonight. These debates are supposed to be fun and inspiring. We've done so many of them. We've done 30 or 40 of them on college campuses and in Zoom format, and they are transformative for students. So let's make it a good evening. I want to give you a couple of ground rules quickly about how we do this on Zoom. First of all, if you've ever watched a parliamentary style debate, especially the British kind, you see people like making a lot of noise, pounding on the table, knocking and all that stuff. Yeah, right. With like Luke, our whip there, is doing. Well, we don't do that, but we do use something called jazz hands to show approval and resonance with something. It's a form of online applause, and it's actually borrowed from American Sign Language. So it goes like this. Let's practice it, everyone. I think you got it. Okay, good. So we'll be using, you please use jazz hands anytime you hear something that you agree with or that, you know, resonates. And also we'll use that when speakers are done and questioners are done. Please keep yourselves muted when you're not speaking. If you want to speak, and I hope many of you will, and if you want to ask a question, just raise your little blue Zoom hand, you know, clicking on participants and toggling that raise hand icon. You can also take advantage of our great skillful whips tonight. You can see that they have the word whip in front of their name. Luke and Alicia and Jessica and Diane, I believe. You can chat directly to them and say, I'd like to speak up or I'd like to ask a question. They're going to relay the message to me because I can't see all 80 plus of you on the screen. But that's how that works. So we're using parliamentary procedure for this debate. And this is a huge part of the reason Braver Angels debates have been so successful in taking the rancor out of an issue and helping us not have what happened in Reston there in 2010. So for starters, this means everybody addresses me, the chair, not each other. And I'll give you more about that in a moment. The format is going to be pretty brisk. It'll be, I'll call for a 4-minute speech in the affirmative of the resolution. After that speaker finishes, I'll open it up to 1 or 2 questions from the audience. And that speaker will be able to address those questions. And then a 4-minute speech from someone in the negative and questions from the audience. We'll repeat that several times. And then the whole gallery will be invited to speak, and I'll call on people. We'll start with 4-minute speeches. After that, when I feel we're winding down a little bit, we'll move to speeches of maybe 3 minutes and 2 minutes, just to make sure we can accommodate as many people here as possible to let them have a voice. For questions, I ask that you really ask a question. A lot of times questioners start making a speech, and then I have to say, well, would you like to make a speech instead of ask a question? But, address a question to me, the chair. Mr. Chair, the previous speakers would have us believe that such and such is such and such. Does he really think this? Does she really think that? You're not going to say, why do you believe this? We're not going to address the speakers that way. Now, can you all hear this little bell? Okay, that's just like my little Zoom gavel, if you will. It means when a speaker is getting close to the 4-minute mark, I'll ring it, and I ask that speaker to, you have 30 seconds or so to come to your finishing statement and close your statement, finish strong. Again, when someone speaks and you have a question for that speaker, you won't address him directly, you'll address me, the chair, all right? So if someone is saying, if Luke is saying, I hold it to be a universal truth that cat people are superior to dog people, the speaker is thanked. I will now invite questions for the speaker. Someone says, Mr. Chair, I have a question. Luke, why do you believe that? I'll have to stop that person and say, I will remind you to kindly address the chair. And I'll do that, and we'll get through it. Parliamentary procedure is a little bit of a new experience for a lot of us. I'm still getting used to it myself, but it's very powerful in helping us have a structured conversation that brings out best thoughts from everyone. All right. Finally, the chat, again, is only going to be used for addressing the whips and myself. And we're going to use the last 10 minutes of this session after the debate closes for a debriefing session where everyone can, I don't have to be Mr. Chair anymore. We're just going to talk about what we've experienced, why you think it might be important for the country. So are there any questions before we start? Whips, do you see anybody? Okay. All right. I will call this debate to order. And again, as I do that, I want to mention that the resolutions for these college debates are chosen and crafted by the students themselves. The resolution in front of us this evening is resolved government should provide healthcare for all citizens. I'm looking for a 4-minute speech in the affirmative. And our first speaker of the evening will be Jessica. Go ahead and unmute yourself.
Thank you, Mr. Chair. Before we delve into the meat of today's debate, I think it is important to remind ourselves of why we are here in the first place. Healthcare is an issue that has been long debated within our society. However, despite all of the opinions, there are a few significant facts that remain. In America, it has been proven that the better your income, the better your health. This is but one of many intersects that exist within current day societal issues. Access to healthcare is about more than money. It is about equality of access, destruction of racial barriers, prevention of disease, the crossing of socioeconomic lines, and the creation of a more prosperous future for all. If we are to approach one issue in society, we must be cognizant of the ties that it has with others. America is one of the most developed nations in the world, yet we find ourselves facing incredible healthcare inequality, an issue that could be solved with government support. Between 2011 and 2013, 38% of those in households making less than $22,500 a year reported being being in poor or fair health. Only 12% in households making more than $47,700 a year reported being in poor to fair health. This was true even when both groups were covered by insurance. Some may think that this has just disproved our point. If both groups had insurance, then providing blanket government insurance will not fix the issue. However, there is no competition and no game to be won when the two teams are not even on the same field. The existence of private health insurance, paired with the absence of a universal option, eliminates the mere idea of healthcare equality. As we have already mentioned, the wealthy will continue to benefit through their ability to have a choice. Their ability to not only choose to protect their health in the first place, but also to choose their desired level of protection. The question of who gets protection is yet another intersect in this discussion. In 2018, the uninsured rate among African Americans was 9.7%, while it was just 5.4% among whites. Some may look to the Affordable Care Act to the expansion that this had to offer to Medicaid. However, there are still many states which have not yet accepted this expansion, which leaves many African Americans stuck in a coverage gap. Any real solution must be able to change the systemic issues behind the issue. This leads me to my last intersection within the healthcare crisis, namely food inequality. The biggest supporter of the healthcare system is the fast food industry. While profiting off of the poor and disguising quality with quantity, the food industry fuels the pockets of the healthcare systems which profit off of preventable diseases. Counties with poverty rates of more than 35% have obesity rates 145% greater than wealthy counties. This is because industry builds communities that will support their cause, filled with drive-thrus and convenience stores. Universal healthcare can ultimately be the only thing that stands in the way of life or death for people living in poverty. This should be an easy choice to make, but it will require the participation of all. It is important to note, however, that universal participation incurs no compromise or deterioration of rights. It is rather a move that will advance all sectors of our population. I yield the time to the chair.
All right, jazz hands for the speaker. Thank you for that. I'm inviting questions for the speaker. And again, to do that, all you need to do is raise your little Zoom hand. And with a gallery of 85 people, I have to believe that someone has a question for our first speaker. I'll recognize a question from Mr. Johnson. Go ahead and unmute yourself.
Okay, so I addressed it to the chair, like.
Yes, address your question to me, the chair.
Okay, so if universal health care is going to reduce health inequities, why is it that in countries like England and Israel, health inequities remain about the same prior and after the implementation of universal health care?
You can answer that. It's there.
So the unique thing about America is that we are an extremely wealthy country with great inequalities that we see every day. The existence of private health insurance allows the wealthy to choose insurances that will give them greater benefits, while the poor are left with absolutely no choice at all. The idea of universal health care is not to provide necessarily a blanket, but just to put everyone on the same playing field. Therefore, if a low socioeconomic status citizen wishes to not have to pay extreme out-of-pocket costs every time they have to go to the doctor, if they want to go get preventative measures taken care of before it turns into a surgery or a lifelong disease that they'll have to pay for years later down the road, they're able to do that with that universal health insurance.
All right, thank you for that. I will recognize another question from Brent Thomas has a hand raised. You go ahead and unmute yourself and address the chair.
Hello, Mr. Chair, and I do have a question. So I'm actually a recipient of Medicaid. So I have for years, I'm a lot older, I'm 31, lost my job, different things from the pandemic. But without Medicaid, I wouldn't be able to afford my depression medications. They're in the thousands of dollar ranges. I have gained a lot of weight because of not being able to eat properly also. And a lot of those social economical issues. And really, the one thing about I can say about with Medicaid in general is they cover health. They don't cover things like dental, eye exams, things that are important. And I bring this up because I had braces when I was younger, and I had
I'm going to excuse
extraction.
Mr. Thomas, I'm just going to ask you if it's okay, could you phrase it as a question? Otherwise,
Yeah.
I'll invite you to make a speech though after Wild proceeds, because it would be great to have you. But can you address a question for this previous speaker?
Yes, excuse me, Mr. Chair. Yes. So with Medicaid, under the like, let's say a government-run system, would that also be something that would be considered? Also improvement outside of that range of health in other sectors?
Go ahead, Jessica.
I think you have hit on the key point here today. Healthcare and has intersects with almost every other issue that we see today in our society, whether that be race, socioeconomic status, food inequality. All of those things eventually add up into who's receiving healthcare, how often they have to go to the doctor's office, and their overall quality of life. I think by making the move for government provided health insurance, we are taking a stand that we have not taken yet in this country, that many other developed countries have taken. So while government provided healthcare may be the first step, I think that initial momentum will bring the country to realize what other sectors we need to invest in order to ensure that universal healthcare is actually being met in all other sectors of societal issues as well. So once we provide universal healthcare, even if it's the most basic level, you can start devoting that money towards the other areas of your life, like dental insurance, like eye exams, those things that we can look at in the future. But without this first initial step, we're never going to get there, and things will continue to be privatized, which favor the wealthy.
All right, with that, the speaker is thanked. Now, I do see another hand, but I'm going to respectfully ask the questioner to hold it. If possible, we have 87 people in the gallery tonight and a number of opening speakers that are going to be making speeches. So there's plenty of time and opportunity to ask questions. And I'm looking for a speech up to 4 minutes in the negative toward the resolution. And our next speaker will be Isidore Johnson. Please unmute yourself.
Hi, everyone. I'm Isidore Johnson, and I am an economics major at the University of Connecticut. And I want to break down why it's going to be a terrible idea for universal healthcare. Even if government healthcare is attainable in other countries, our political system would not be good at doing this. We have examples of the government trying to do healthcare. It's a disaster. Look at the Veterans Administration. One VA-run hospital in Phoenix literally had a wait list between 1,400 and 1,600 veterans for as long as 2 years. This resulted in just 40 deaths from wait times. If things become less efficient as people try to scale up these programs and make them more national and remove alternative methods of doing this, the negative effects of government-run healthcare will simply get worse. In our current system, Medicare for all, or just Medicare itself, actually has higher per capita administrative costs. So whether or not people are going to be paying more for healthcare as a share of income, either through taxes or through personal spending, might actually go up if you end up supporting Medicare for all or universal healthcare. Or B, rich and poor people aren't made better off as a result of this. A big claim is that this is a really expensive plan that doesn't actually improve health outcomes. So the gold standard for experiments on whether or not providing government healthcare works is the Rand Health experiment. They did an experiment to see if giving insurance would improve life expectancy compared to a control group. It turns out that it did not. But when you added in cost sharing or less insurance, people ended up consuming less health insurance than otherwise. Basically, what I'm suggesting with this is that when you don't actually have to pay the costs for the things you want, people tend to overspend or overuse. So ultimately, if we had a universal system, you'd probably see a different sort of rationing to determine who actually gets the healthcare. It's not like in other countries with universal healthcare, you see a situation where people are just all getting healthcare. It's usually they're rationed by other things like waiting lines, which often take up to a couple years. Third, investment in health innovations. The United States is one of the world's leaders in producing medical intellectual property. A big portion of this is that pharmaceutical companies are paid a lot higher by private insurance companies than government-based Medicare. Without a private market, the odds of improvements are pretty low, which means that if we're thinking about the aggregate health outcomes, we're probably going to see worse results under a universal healthcare system. Furthermore, if you made this a government-run healthcare, what would be decided upon would be capriciously or would be run capriciously by politicians. Ronald Reagan famously cut funding for gay causes and made it really hard for AIDS to be studied. If we give the entire sector over to people like Ronald Reagan or other bigots, which might just happen, you're going to probably see a situation where minority groups are not going to have access to life-changing things. Next, we've tried many single-payer systems in Massachusetts and Tennessee. Both of them were a complete failure. Next, government healthcare in other countries is also bad. In Great Britain, there's a 4.2 million patients on a waiting list, and Canadian patients wait on average 21.2 weeks to receive any form of specialized healthcare. A big reason why is governments have been able to get away with this is through medical tourism, or people from other countries coming to the US to actually get their treatment. Also, Canada's healthcare relies on an import of other doctors to survive. Jay Bhattacharya, writer of the Healthcare Economics textbook, notes that when you involve the government more in healthcare, life expectancy actually goes down. Next, Obamacare made things worse, not better. Physicians have had to record a lot more information, and this just creates tons of waste and actually reduces the hospital's profits by the tune of $528 million. And last, the non-tax partisan tax foundation argued that a Medicare for All plan would reduce GDP by 9.5% over the long term. That's a lot of money. And not only is it a lot of money, but it represents our direct capability in saving lives. We shouldn't do programs that completely imperil future generations for something that isn't even likely to make people's lives better off. Thank you, and I end my speech.
Thank you, Mr. Johnson. Jazz hands for the speaker. I'm inviting questions for the speaker, and our first questioner will be Marissa Cooper. Please go ahead and unmute yourself and address the chair.
Hi, Mr. Chair. I just had a quick question for Mr. Johnson.
For the previous speaker. Yep.
Yes. So my question is going towards the whole that there wasn't much of a difference between those who were in poverty and those who could actually afford healthcare. Were in those statistics, were there any circumstances that stated about comorbidities, patients keeping up with their appointments or taking their meds properly, that reduced the differences as far as it being better off, or those who are able to afford, and also them making their health better?
So I think you're referring to the Rand Health experiment thing, right?
The questioner is
Yes.
referring to.
Yeah. So there were two things that were slight improvements under the system. Number one, people experienced slightly less anxiety. And number two, this one rare disease had a slightly less comorbidity under less cost sharing. But other than that, the results were nearly identical in terms of everything except for spending. Did that answer the speaker's question?
Marissa Cooper, did that answer your question?
Yes and no. I mean, you addressed that it lessened the anxiety and one comorbidity, but how many comorbidities did these patients have, and did they keep up with their appointments? Did they go to every appointment as they were supposed to? Were they compliant, or were they non-compliant? Because I have seen that where non-compliancy shows that it's going to end up in death, versus those who are compliant with their medications and their appointments, their life expectancy increases.
To answer the speaker's question.
Isadora, I have a couple of other questioners I want to include.
Okay.
Go ahead.
Oh, cool. I was going to say, to answer the speaker's question, I believe they looked at a range of comorbidities. This was the only one that showed any tangible improvement. Regarding compliance, I don't believe that was a primary factor that was measured. But I wouldn't see how giving people healthcare would affect the compliance. So I don't really see how that would be relevant to whether or not it actually improves lives. I hope that answers your question.
All right, I see a hand raised from Brent Thomas. And can you please go ahead and unmute yourself and if possible, show yourself on video and ask your question to the chair.
Yes, Mr. Chair, my question is, wouldn't there be something more like something independently run, like France's healthcare system? They actually subsidize, the government does, to private insurance companies to actually run the system for them, and thereby reducing costs through regulation of products like insulin and things like that. Is that a possibility for us in the United States?
Go ahead, Mr. Johnson.
Yeah, to answer the speaker's question, it is a possibility, and it would be less bad than single payer healthcare, but it would probably be less good than things like privatizing other aspects of the market. So to give the speaker an example, there are currently a lot of certificate of need legislations that basically make it impossible to start providing healthcare of any sort, which tend to add up costs associated with healthcare. There is also in the current system surprise billing. If you wanted to control the costs of healthcare, being fully transparent about the costs and allowing people to compete over state lines would probably yield better results than subsidizing something more. Obamacare attempted to do this subsidization scheme a little bit, but the results were counterproductive and ended up increasing healthcare costs while also diminishing quality and choices. So it is possible to go for a more France, Germany, and Swedish model, but it might not be desirable to do so. But it is less bad than a single payer system.
All right, with that, the speaker and questioners are thanked. Jazz hands for them. Thank you for that exchange. And I do see another hand raised. I will ask that questioner to please hold on to that question because you'll have another opportunity to ask it shortly. I'm looking for up to 4-minute speech in the affirmative. And our next speaker will be Logan Carlisle. Go ahead and unmute yourself.
Hello, everyone. My name is Logan. I'm on the debate team at Frostburg University, and I am for government-provided healthcare. The government has generally, since the 1930s, taken the well-being of the sick, poor, and old into its care after the extremes of poverty were put on display for Americans in the Great Depression. Wildly popular programs such as Social Security, the VA, Medicare, and more have provided healthcare to millions of Americans and served as examples of sensible programs that politicians would not dare undercut due to their support. The VA in particular had an approval rating of over 80% last year. These programs require the government to massively increase its spending, but they have strengthened our country and provided a safety net that prevents the most vulnerable of our society from falling into absolute poverty and miscare. The advantages of these programs should be expanded to the rest of the population in the form of government-provided healthcare. The healthcare industry is an industry that is dissimilar to any other. There are a number of moral and emotional and even existential considerations that just aren't present in other American industries. Leaving such complex issues and situations in the hands of companies who are operating on a for-profit mindset is, in my opinion, immoral, as it ends up leaving many without proper treatment for not providing enough of a profit to the insurance company. 31 million Americans are completely uninsured, which leads to 31 million Americans being overall weaker, sicker, and more likely to die earlier. 26,000 of these Americans die each year without any sort of health coverage, which prevents them from seeking treatment for illnesses or disabilities which could have helped them and prevented their death. Concerns about costs to the middle class are valid and to general taxpayers overall. But upon further inspection in our current system, Most members of the middle class in particular already pay for most of the private insurance. Most people pay a tax for healthcare already. It's just this isn't to the government, it's to a private company. It's a private tax. A government tax would be cheaper for the majority of Americans, only becoming more expensive for wealthy taxpayers and corporations. Once you factor in private healthcare premiums to the official federal tax rate, the average tax rate is around 40% for the middle class, whereas it plummets to 23% for billionaires, once again, when all of these private taxes are included. The role of government is to protect its citizens and provide for their basic well-being. Not only should the provision of healthcare be seen as the responsibility of the government, it should be seen as an act for strengthening our country as a whole. A healthy population with a healthcare system that allows their medical needs to be addressed would increase general productivity, activity, accessibility, and overall level of happiness in the United States. That is the end of my statement.
Thank you, Speaker. And I'm going to open it up to questions. I do see a hand raised from an individual labeled H. Sack. Do you have a question? It's a person who's not, I cannot see on video. So if you're not there, then we'll move on to a question from Mr. Phillips. Go ahead.
Thank you, Mr. Chair. I just want to know if the speaker sees Social Security, which you mentioned, as being the basic template for how most other American welfare and social policies have been done, or if he thinks that that is one template, but that there are other ways that it has been done as well.
Go ahead, Logan.
I would say that Social Security as a whole is an acceptable template. The major problem with Social Security that are most commonly brought up nowadays is pretty much that the amount that we're supposed to be paying into it has not adjusted with inflation and overall rates as it was when it was first introduced back in the 30s. Then again, I'm just listing it primarily as an example of, what is essentially a federal insurance program. It's insurance for the elderly. I'm listing it made primarily just as an example of a successful, relatively program.
Thank you, Mr. Chair, and thank you to the speaker.
Thank you for that. I did get a chat message from H. Sack again. So if you would like to ask a question, I'll invite you to ask it now. Just go ahead and unmute yourself.
Hi, can everyone hear me?
Yes.
Okay, sorry about that. I had some technical difficulties. Okay, so my question is,
but we can hear.
Okay, my question was, so looking at the healthcare debate from the non-privatized perspective, what would, let's see, sorry, I'm trying to read my handwriting. Insurance wise, so we do pay a lot into insurance. If healthcare was to be privatized, how would that potentially, would you see that potentially working if we were to remove the insurance aspect of healthcare in a non-privatized?
How would the speaker see that? Go ahead, Logan.
I would just like to address a matter of terminology. There will always be an insurance for healthcare. It's just a matter of whether that insurance should be private or public. As it stands currently, due to premiums and whatnot, the middle class disproportionately pays a large part of their income to these premiums, as when your income starts to increase, you're still pretty much paying the same premiums. It's just that it's less of an overall percentage of that person's income. Ideally, under a government-funded program, this would be reversed and it'd be more resembling a progressive tax rate, whereas your income increases, income past a certain point is taxed higher, whereas lower income individuals are not taxed nearly half of their income for private healthcare alongside various federal taxes.
Okay, with that, the speaker is thanked. Jazz hands for the speaker and questioners. You're all really starting to unpack this topic nicely. I'm going to be looking now for a speech in the negative, up to 4 minutes, and the next speaker will be Mr. Phillips. Go ahead and unmute yourself.
Thank you very much, Mr. Chair. Let me go ahead and set my personal timer here real quick.
I've got
okay. Oh, great. Well, thank you for that as well. So hi, everybody. My name's Luke. I work with Braver Angels, and I'm calling in from Northern Virginia right now. And I just want to say ahead of time that I don't really consider myself to know much of anything about healthcare. I have my opinions on it. I have my ways of assessing through my uncertainties with it, but I don't think I would call myself anything resembling an expert, anything resembling even a wonk, anything even resembling like an amateur kind of policy scholar of healthcare, just because that's not the world I live in, right? But that being said, public policy being public policy, there's probably good insights that can come from various places. So I will do my best to outline, I guess, the ways my confusion and questioning has gone, and maybe that can be helpful in explaining why me and various other people of my various dispensations do not necessarily favor universal government-provided health insurance as the main primary solution in policy. So in a nutshell, I actually like a lot of the spirit of what Andrew Yang, for example, has proposed in various questions related to this. I even like a lot of things that Alexandria Ocasio-Cortez has proposed on some of these kinds of things. A standard conservative argument against those, of course, always is that, well, we are a federal system with states and the federal government and cities and localities and businesses and employers, and you can't just do a one-size-fits-all solution on a diverse and pluralistic country. That's true for what it's worth, but I think it goes down to, there are some deeper things that I think are interesting. And for me, the interesting question here, as with a variety of other policy areas, housing, education, retirement insurance, all that, is it boils down to some degree to the question of the social contract, right? Is in a modern economy, in a modern society, do American citizens deserve to have a certain standard of living secured for them by some means through public policy? And I think most of us would say yes on that. I think even a lot of conservatives and libertarians say yes to that. But then you get to the question, and politics being the art of the possible, this is an important question, you get to the question of how, and who provides that, and how is the mechanism for that to be provided, right? So a friend and mentor of mine, a writer named Michael Lind, articulated helpfully that he sees three basic approaches to healthcare provision in the United States. He sees what he calls welfare statism, universal benefits, sometimes means tested, sometimes not, provided directly by the government to each individual citizen. Then you have welfare individualism, which is a competitive market system whereby individuals are obliged to buy their own health insurance and find their own health providers from a competitive market thing. And then you have welfare capitalism, which is the system wherein employers, as part of the package of employment, provide their employees, and sometimes a few more than their employees, with healthcare benefits, with retirement benefits, et cetera, et cetera, et cetera. And in various ways, there are bits and pieces of that system in our general American healthcare system. But I also think the more I've looked at recent attempts and previous attempts to expand healthcare coverage to something maybe less than universal, but something bigger than we have right now, it seems that a lot of the most successful ones of those, and this included parts of the Affordable Care Act, and this has included some of the most creative policies coming from Republican presidents all the way back to Richard Nixon, has been an expansion of the incentives and of the pressures on the American business community to provide better benefit packages to their employees, right? And I will finish up as fast as I can, but long story short, I think one of the big social questions in the United States right now, one of the big divides between middle class and working class, and if you've been both, you know that there's a difference. One of the big divides is whether or not your job gives you stability and security and the benefits that are involved with that, or whether your job is a job that you do and you get a salary and you get wages, but it doesn't give you necessarily the security there, right? And it seems to me, and I would venture on a limb that the majority of those of us in this room either presently are in or are probably going to soon be entering jobs that have that kind of benefits and security. If to the degree that that government policy has been able to do anything, I think one of the interesting things, and we can talk about what this means in Q&A eventually, is how do you get that to American workers who are not always in the same kind of cushy positions that those of us who work at nonprofits and colleges are? And I think that's as fair a question as the question of whether we should be trying to do a universal system that will encounter much more knee-jerk opposition and have much more technical problems than the employer benefits system as itself. Now, Mr. Chair, I know I've gone way over time, so I will apologize for that, but I look forward to questions and comments and vicious personal attacks from the rest of my fellow debate attendees.
Hopefully no vicious personal attacks. But you did fine, Mr. Phillips. Thank you. Jazz hands for you. And I do have a raised hand. I'm inviting questions for the speaker now. Our first questioner will be Marissa Cooper. Go ahead and unmute yourself and address me, the chair.
Mr. Chair, so my question is, so he's going off based off of, who has the say so and when and where, why, how, all these questions, but turning to the pandemic, is it only something as the government sees fit or the doctor sees fit as to who gets this healthcare? Because if you go back and look at it from COVID-19, everybody got free testing. Everybody now, the vaccine is being provided freely to certain people and starting slowly and whatnot. So why is it that that's free and it doesn't come with the healthcare costs just because it's something that we don't know? Or is it because is it versus what we do know is my question.
Well, and I think you cut out a little bit there in two spots. So I'm not sure I heard the entirety of the question, but let me know if this is a sufficient answer. You're wondering about why some things are prioritized over other things, right? To be honest, I don't have a good answer to that. I don't have a very good answer to that at all on my own case. I don't study this stuff deeply enough to come on those things. I think the coronavirus pandemic and the experiences of medical triage and questions on what should we prioritize, the ventilators or the vaccine or whatever, I think that opens up some of the facts that fundamentally healthcare is a political question. It's not a question about rights. It's not a question about science and technology. It's not a question about which particular moral system is the best. Those are all parts of it. But fundamentally, there are different approaches to each of those as well. And so if there are different approaches to that, we all have to fight for that in politics, right? So I think at some level, the question of how do we prioritize, right? There might be a right answer. I don't know what that right answer is, but I think it is just testimony to me that I'm not sure that there is a correct system for deciding that. I think there's a deep level of political questions that a lot of folks who I've read seem to believe that it's more just mere questions of technocratic economics or just the math. And I don't think it's quite there. I think there are choices that have to be made in this. So yeah, so I hope that's it. That I don't think that answers your question, but that explains my approach to the question there. So
thanks, Mr. Phillips. I have another questioner queued up for you. This will be Stacy Baldwin. Go ahead and unmute yourself and address the chair.
Thank you, Mr. Chair. Mr. Chair, I would like to ask the speaker how we could motivate or even go as far as to legalize put into law the having companies provide healthcare or insurance for all.
I think there are a lot of important precedents in earlier parts in American history on this, but the thing that I always keep coming back to is the system that was in some ways put in place during the New Deal under Franklin Roosevelt's administration, not just the universal direct insurance and benefits to citizens, but the establishment of industry-wide standards of like business practice, which included things on how do you treat your workers, how do you treat your employees, how do you do that, which brought not just the business management and the government to the table, it also brought the labor unions to the table, which were at that time much more powerful than they are now. And it also brought consumer advocates to the table, and it brought various interest groups to the table to be able to do these kinds of things at a negotiated settlement as related to people's salaries and people's benefits packages and all that, which, as many people have noted in the last 2 years or so, that system of American partial corporatism, whereby it wasn't just business versus government, you also had a real contingency and a real power in labor and in consumer advocacy and in a million other groups, that has been undercut for a variety of reasons in the last 50 or 60 years, and we don't have that now. And so a part of me, as I think about how do you go back to that, I think getting in the mind that that we had in some ways more prominently earlier in the 20th century than later in it, whereby it's not just about GDP, it's not just about business efficiency and legal rights. It's also about having a sense of the multiplicity of actors that all have a legitimate stake in these decision processes. I think that's part of it. I don't know specifically what that means in terms of laws and pressuring these kinds of things. Again, this is something I think about, but not think deeply about, right? But I don't know. I think there are plenty of precedents for this and other things in American history, and I am just eager to dive into some more of them. So,
all right. With that, the speaker is thanked, and the questioners, jazz hands for all of them.
Thank you.
This is going well tonight. I'm looking for a speech in the affirmative now up to 4 minutes. Our next speaker will be Delaney. And if you're with us, Delaney, please unmute yourself and go ahead.
Thank you, Mr. Chair, and apologies to everyone in advance. I have been having Wi-Fi problems this entire debate so far, so if I cut out, my apologies. My name is Delaney Bluebaugh. I'm a junior at Frostburg State and I'm the secretary of the university's debate team. And like Mr. Phillips, I am by no means an expert on healthcare, so just a little preface on that as well. Universal healthcare has worked in many other countries, especially those at least somewhat comparable to the United States. While the implementation of universal healthcare in the United States may seem super complex, boiled down, it's actually pretty simple. Let's look at a few other nations that provide public health coverage to its citizens as case studies to this issue. First, looking at Australia's healthcare system. Australia has had universal healthcare since 1984, so nearly 40 years. In Australia, the federal government provides funding and indirect support for inpatient and outpatient care and for outpatient prescription medicine. States own and manage service delivery for public hospitals, ambulances, public dental care, community health, and mental health care. And local governments play a role in the delivery of community health and preventative health programs, such as immunizations, which, as we all know, is very important in this pandemic, and the regulation of food standards. Australia's public health coverage is funded by the national tax system established by the federal government. But don't worry, there's still private insurance available too. Australia's private health insurance provides readily available services with out-of-pocket fees, more choice in who your physicians and medical staff are, faster access for non-emergency services, and rebates for selected services as well. Though Australia does offer free public health coverage for all citizens, the federal government still does encourage people to enroll and invest in private insurance through a reward system like a tax rebate. For individuals who choose not to enroll in at least some form of private insurance, they may face an income-based penalty payment for incomes that exceed $90K for single individuals and $180K for families. And Brazil has universal healthcare too. In fact, Brazil's constitution dictates that healthcare is a universal right and that it is the government's responsibility to uphold and protect that right. Brazil's universal healthcare was established in the 1980s and has also been in place ever since. Universal healthcare, as provided by the Brazilian government, has three major components: the universal right to comprehensive healthcare at all levels of complexity, decentralization with responsibilities given to the three levels of government, federal, state, and municipal, and social participation in formulating and monitoring the implementation of health policies through federal, state, and municipal health councils. And those two nations aren't the only ones either. Our neighbor Canada has universal healthcare too, which was originally established in the late 1950s and then reorganized in the 1980s. See a trend here? And you guessed it, Canadian universal healthcare has been in place ever since. The integral properties of Canada's public health coverage augments publicly administered, comprehensive in coverage conditions, universal, portable access across provinces, and accessible healthcare into its framework. just our neighbor next door. America could have this, or at least something like it, for Australians who make under the income-based penalty threshold and do not have private insurance. They ultimately opt out of private insurance because they have the option to. Australia's universal healthcare system has been in place for nearly 40 years and has, to my knowledge at least, for the most part, gone off without a hitch. And America could do the same. For the upper middle class to the 1% who likely would enroll in private insurance anyway, an income-based penalty payment would be like chump change. But for the millions of Americans that fall significantly below the income-based penalty payment threshold, the universal health care that America could provide to them could be the thing that stands between life and death for each of them. As my colleague Logan said, the role of the government is to protect its citizens and to provide for their well-being. By transforming the American healthcare system to offer universal public coverage with an option for private insurance to enroll in supplemental private health insurance, the federal government would be doing just that. I yield my time back to the chair. Thank you.
All right, thank you for that, Delaney. And quite a few hands are raised. I'm not going to be able to accommodate every one of them right now, but please, if I don't call on you, keep your question in the warming oven because we'll pull it out shortly. Our first questioner will be Sierra. Go ahead and unmute yourself and address the chair.
Thank you, Chair. I was wondering if we got rid of private health insurance and switched to universal health care for all, how would that affect the cost in what people are paying?
Go ahead, Delaney.
Thank you. So the compromise to getting rid of private insurance completely is to have universal healthcare, a single payer system, but with duality, so that there is still the private insurance aspect. So for example, consider public health coverage as a public investment to that of public education. The government is, investing in the public health of all of its citizens and is allowing to a certain income threshold complete health coverage for, people who make under a certain threshold of income per year. But another option is to have those individuals who exceed that income threshold be able to have private insurance. And with universal healthcare, it can increase the demand for medical services, which would make these services across the board with both public coverage, private insurance more affordable, available, and accessible because we are, actually needing it and being able to utilize it more. Additionally, the costs of insurance, medical services could change significantly as well because the government can control with this universal health insurance coverage bracket of the healthcare system could kind of control the price of services for at least individuals under a certain income threshold as well.
Thank you for that. I'll recognize a question from Vicki Stevens. Go ahead and unmute yourself and address the chair. Questions?
Yes. Oh,
yep.
Sorry. Yes, Mr. Chair. My question is, when she was talking about with Australia having the universal care, but also private insurance, where does that leave people that are facing the same medical issues? The people that have the private insurance, are they going to get the care first opposed to somebody that just has the universal care, even though they might be having greater medical issues than the other person with the private insurance as well?
So I did lose you because of the Wi-Fi issue that I'm currently experiencing, but I got the first part of it. So what I'll say is, and hopefully this answers your question, is that in Australia, there are two kind of different arenas of medical service, those who are specific to the public health coverage and those that are, the more private insurance medical services. And so when individuals who, all citizens in Australia, as long as they're a citizen of the country, get public health coverage. And, if they choose to invest and enroll in private insurance as a supplement to their medical public coverage that the Australian government provides, they do have kind of a different arena that they can, direct their medical needs to, whether that is emergency or non-emergency. But if they, choose not to, and they go to the public health coverage arena where to all Australian citizens, then they all get the same care. It's not that it's a first come, first serve basis. If somebody shows up who only has public health coverage into a Med Express, for example, if you will, an urgent care, and if an Australian citizen who only uses the public health coverage shows up, and then, an hour later, they're both waiting, and another individual who has private insurance shows up to the same urgent care, just because he or she has private insurance doesn't mean he's going to receive the care first. So they're like the two different arenas that people juggle. If they want first come, first serve care, they usually, it's recommended that they go to public health coverage medical services that are provided by the federal government. But if they want that faster non-emergency service, the Australian government, encourages that they enroll in private health insurance as a supplement.
All right, with that, the speaker is thanked. There are a couple of other hands raised. And again, for Rebecca Vardaman and Kendall Kidwell, I will ask if you could hold on to your question a little bit longer, just because we have a number of speakers that are going to come up momentarily. And in the interest of allowing them time, I want to move along. I will say that this evening is really fulfilling my hope, not resembling in any way the healthcare town hall in 2010 that I showed you when I opened up the debate. And so thank you for that from the bottom of my heart. Our next speaker, I'm looking for a 4-minute speech in the negative, and our next speaker will be Greta Wagley. Please go ahead and unmute yourself. You have the floor.
Okay, can you hear me?
Yes, Greta.
So fundamentally, it is a question about rights. That's what it comes down to for me, is healthcare a human right? No, it's not. A right is not something that someone or the government gives to me. It's something I already possess that no one can take away. The government doesn't buy me a gun or give me land. The government exists to make sure no one takes my property away. No one gives me or imposes on me a religion. The government exists to make sure no one, including the government, interferes with my religion. The government doesn't give me my life. God does. Rather, the government exists to make sure no one takes my life away. That's why I'm happy to pay for the police. I distinguish between rights and needs. I actually go further though. I distinguish between needs and wants. For example, a lot of people say sexual release is a need. Absolutely not. It's a want. And all needs and wants can be done morally and immorally. Pornography use is an immoral way to accomplish sexual release. I believe the only moral way to do sex is between a husband and a wife. Healthcare is a need, and it can be provided morally or immorally. Let me paint a picture. I see a woman, she's sick, suffering, I want to help her. Here's the wrong way to do it. I see another woman, a waitress, done with her shift, laden with tips. I mug her and steal her money, not for myself, but to give the sick woman. That is unequivocally wrong. I'm the government. The waitress didn't authorize me to take her money to give to the sick woman. I don't authorize the government to use my tax dollars to pay for, say, my ex-boyfriend's toe wart removal or even for his heart surgery. Only I decide if I'm going to help pay for his heart surgery, which I would, by the way. I only authorize the government to use my tax dollars to protect the negative rights enumerated in the Constitution. Here's the right way to help the lady. I reach into my pocket and help her myself. But there are tons of other ways I can help. I can bring her to a church. I can do a GoFundMe. I can give her medicine from my own cabinet. I can take her out to one of the many private providers available, at least for now. That's the beauty of a free market healthcare system. It creates incentives to provide the best care and to innovate. Its bane is government regulation. All those socialist Western European systems are completely reliant on the innovation of the competitive American medical field. Vaccines, anyone? If it collapses, they collapse. And how about the rights of doctors? Single payer systems underpay doctors, force them to perform unethical procedures or go out of business, and stifles investment in new treatments that make American medicine the best in the world, which it is. But the actual important point is this: as long as Americans disagree on if it is a right or not, single payer federal health care should not be implemented. That would be immoral. It raises countless moral quandaries and coercion issues. The government, which was created to ensure that we can all freely pursue our beliefs, that's why I love being an American, that freedom will now violate and force me to violate every single one of my deeply held moral beliefs. The government can use my money, tax money, to fund abortions and force doctors to perform them. You might say, well, there are degrees of separation there. You're not actually sliding your card at the clinic. It might not offend offend some people's conscience, but it certainly offends mine. Every choice I make is informed by my morality. I don't want to fund taking away someone's life through abortion with my pocket money or my tax dollars. I have no right to, and I don't want to live in a society that compels its citizens to do so. I don't want to help my ex-boyfriend kill himself with assisted suicide because of all his toe warts. Warts, by the way, are the only thing government healthcare is efficient at addressing. If you have anything more complicated, a tumor, you're a goner. But these are fraught moral issues. To force me to violate my conscience to give you healthcare is an abrogation of my rights. Universal single-payer healthcare is not a right. It violates rights. And if you're still wondering about the utopia of federal healthcare and you're not convinced by how the government handled the pandemic, look no further than the Federal Indian Health Services, which is a horror story every day of malfeasance and suffering for decades now running. 50% of people already have federal healthcare. They suffer more than the other 50%. It is immoral and it does not work. Yield my time.
All right, thank you for that, Ms. Wagley. And adding another dimension to the debate and pressure testing our topic, which is exactly what we want to happen in an event like this. I do see questions for the speaker. Our first one will be Logan Carlisle. Go ahead and unmute yourself and direct your questions to the chair.
Thank you, Mr. Chair. I appreciate the transition of the discussion into the matter of rights and the role of government. I would ask the previous speaker if, or positive general, question overall, if it's right for tax money to be used for other government services that may be used to, sort of fulfill acts or actions that one may disagree with, such as roads. Roads are a huge, national government sort of provided and maintained system that, one way or another may be used to facilitate illegal actions or there's other actions that, I personally disagree with. However, I don't necessarily think that we should not fund roads just because it allows what I may consider immoral activity that I do not personally agree with, and I don't want to necessarily fund myself.
Go ahead, Greta.
Is the question, do I believe the government should fund roads?
No, I'm equating roads to other government services that we were talking about, such as healthcare. It is, do you believe the government in general should provide any services that may be used for actions you may personally disagree with?
My answer is that there is no moral equivalency between taxpayer-funded roads and using my taxpayer money to pay for abortions or gender reassignment surgery or assisted suicide. The moral equivalency there is not the same, so it's a logical fallacy. It's my answer.
All right, I see a raised hand from Mindy Burris. Go ahead and unmute yourself and address the chair.
Hi, Mr. Chair. Can you hear me okay?
Yes, perfectly.
Okay. Hi. My question to the speaker is, I completely respect what you had to say.
I respect what the speaker had to say.
What the speaker has to say. And as far as you saying it's a right and, to dictate where your tax dollars go to, and I completely get that. I'm a nurse. I work for a nonprofit hospital. My healthcare insurance coverage through my job is very expensive and it does not cover a lot. So the money I made to go to college to make more money, in return monthly, I'm paying more in my healthcare coverage. Do you feel like the working class that's paying for their healthcare coverage, that's a couple $100s a month, do you feel like it would not be in our best interest to be a part of the universal healthcare coverage so we have that coverage for free?
All right, just does the speaker feel, just if we can remember.
Does the speaker feel that it would not be in our best interest to use, our money differently, that free healthcare coverage versus paying a couple $100s a month, and we are the working class?
Go ahead.
Okay, I'm not totally sure I understand the question, but I'll just give you my answer. I've also been working class in my life, and I paid for my health insurance, and I think that's a good thing for me to pay for. Citizens should pay for their own health insurance. They don't have a right to get health insurance from the government, but the way to make health insurance better, it is a terrible system, and that reason for that is government regulation. President Trump really decreased a lot of regulations on the healthcare system. That was really good, but we need to do a lot more so that the private providers can stimulate more competition and that you'll have better options. The problem that we have now is just so expensive. Isn't the private provider's fault? It's the government's fault. Yeah, that's my answer.
All right, with that, the speaker is thanked and the questioners, jazz hands for all of them. And again, it's great to see the topic being pressure tested. These Braver Angels College debates have spanned the gamut from defunding the police to taking down Confederate monuments to building the southern border wall, and a lot of very, very hypercharged, polarized topics. And tonight's topic is nothing short of that. You're all doing beautifully well, and I'm grateful that this format is holding true. So jazz hands for that and for all of you so far. And thank you for the other questioners who had their hands raised. I'll recognize you soon. We're going to move to a speech in the affirmative of the resolution, up to 4 minutes. Our next speaker will be Lauren Nordquist. Please unmute yourself and go ahead.
Hello. In America's current healthcare system, if you're impoverished, unemployed, or otherwise disadvantaged, it is a system not created to include you. However, while the system may not be inclusive, healthcare is still a universal need amongst all humans. Just because someone is unemployed does not mean they're also no longer in need of medical attention. Unemployment does lead to needing subsidized programs that will be paid for by taxes, just as education and military costs are. But this is a cost that could be going towards preventative healthcare rather than emergency medical procedures. In addition to tax dollars for subsidizing programs, federal and state taxes are taken for healthcare costs, as well as paying insurance premiums and copays for appointments and cash prescriptions. If the healthcare system were to shift to being government provided, all the individual deductions would be eliminated and one lump deduction from income would be taken. Different studies have had widely varying results in determining the exact difference in tax deductions between the current and proposed model, ranging from Americans saving money to little to no change in small increases. Nonetheless, increased universality of charges would not be the only change. Medical costs in general would significantly decrease. For all procedures, appointments, and medications, costs would be much lower to no charge at all. Thus, even with possible increased income tax, the savings from decreased medical costs can balance the difference and overall result in more accessible and affordable healthcare for American citizens. There are also the monetary benefits of having a significantly higher average of health of a general population. More people that are able to produce and consume and capitalistically stimulate the economy. As seen with the rollout of COVID vaccinations, having open access to the public and ensuring all receive medical attention is an absolute benefit to the citizens. Removing the link between healthcare and employment or physical ability ensures everyone is able to get what they need. No matter the simulations that have been conducted to estimate the increase in income and overall healthcare spending per person and the government, it boils down to if Americans want to help their fellow citizens in attaining healthcare or not. Back to you, Mr. Speaker.
Well, that was brief. Thank you, Lauren. I'll recognize a couple questions for you, if that's okay. First question will be Kendall Kidwell. Go ahead and unmute yourself. And if we can, we can see you on video. That's helpful too.
Okay, can you hear me and can you see me okay?
Yes, and just as our whip Jessica has recommended and asked the gallery just to remember to avoid personal pronouns and just use the previous speaker in that parliamentary format that helps us. Thank you.
All right, Mr. Speaker, my question is, or Mr. Chair, my question is for the speaker. With being for the universal health care, are you afraid that with universal health care, the government is going to be able to choose a specific treatment for people rather than the choice of treatment that people have with private health care? And are you afraid that with universal health care, it is going to diminish the private practices that are not federally and government funded through the United States? And that's my question.
Is the speaker afraid? Yeah. Go ahead. Lauren.
Okay. I do think that it would be quite possible without the proper planning in place and the proper funding for just like one mainstreamed treatment to be chosen for many different like medical conditions throughout healthcare. But I do know that that is not a one size fits all deal at all with medical conditions. So it would just need to be thoroughly planned and not like half planned at all. Excuse me, sorry. Let's just, okay. And then could you repeat the second half of that question?
Kendall,
Or
can you address the second point of your question to the speaker?
The second point of my question to the speaker was, did the speaker feel that with universal health care, it would diminish the private practices and private providers within the communities in the states versus having to be only given the option for universal health care that was governmentally funded?
I do think with the opt-in, opt-out program that has been mentioned previously, that would eliminate significant changes with the use of private practices. I think that people who would want to go to private practices before, if monetarily could opt out of the universal health care, then they would opt into the private practices and continuing to support those doctors rather than participating in the universal health care provided by the government. However, that does mean that the universal health care cannot be just like underlooked or underplanned. It still needs to be like fully funded in order to have still like basic health care and like practical and like useful healthcare, not just something that is like a quick fix on something that is a much larger issue.
All right, thank you for that. Jazz hands for the speaker and questioners. We'll move on to a speech in the negative. I'm looking for up to 4 minutes from our next speaker, who will be Connor Murnane. Please go ahead and unmute yourself, and you have the floor.
Hello, am I coming through?
You certainly are.
Great. So my background is in political theory and political campaigns. I love talking about rights, and I have just enough information on the topic to not sound like a total fool. The government should not provide healthcare to every citizen. That being said, I want to start off. Healthcare is a right, but a right in the same sense that free speech or free association is a right. No one or the government can take that right away from you. This does not mean that the right must be provided to you. No one else must host these Braver Angels debates or publish a newspaper solely to provide me a platform to exercise my right to free speech. Treating healthcare as a thing or a right that others or the government have a duty to supply to you has far too many dangerous consequences. With healthcare provided by the government, there's always the danger that everybody will be mandated to have only a single choice in that care supplied by the government. With faith in the government at an all-time low, is this a reality you want? On the other hand, treating healthcare as a commodity that is not handed out by the government has numerous benefits. To make improvements to a commodity and make it cheaper, two things are necessary: freedom of labor and profit motivations. The government destroys both in the healthcare industry. The government decides medical reimbursement rates, which creates an incentive for doctors not to take government-sponsored health insurance. It regulates how doctors interact with patients, their mandated training requirements, and the type of insurances they must hold. This causes fewer Americans to study to become doctors. And the free market takes true effect, and the individual can join with others into insurance risk pools that best suit their needs. Tons of options are found. Some patients might prefer a lavish plan that covers many different services. Others might prefer a leaner plan that protects against catastrophic accidents and illnesses, but it costs much less. This causes companies to compete for the few customers, which innovates the product and cheapens the cost. For example, Rx.com came into existence to compete on price and quality with local pharmacies. It helps patients who choose to buy drugs with their own out-of-pocket funds. Walk-in clinics emerged for patients who bought primary care with their own health dollars. Other firms like Teladoc began providing phone and email doctor consultations completely outside the third-party payer system. The government's job should not be to regulate health insurance for everyone. The government should protect customers' freedom to purchase and insurers' freedom to offer insurance plans mutually agreeable to both parties. The government must not infringe on an individual's right to choose the best healthcare for themselves and their loved ones. Thank you. I yield my time to Chairman Spry.
Thank you, Connor. I see a number of hands raised. I wanted to make sure that, that they're not from the previous speaker, but I think I see a couple of new ones. So first of all, Logan Carlisle has a question. I'll recognize you first, and then I'll figure it out after that. So please go ahead and address the chair.
The previous speaker compared healthcare as a right to the same way that freedom of speech is a right, as in the government sort of protects your right to have it rather than necessarily providing you that thing to you. I would like to ask what the previous speaker would think about people who do not have the option of exercising their right to have healthcare by being too impoverished to do so.
Go ahead, Connor.
First, let's backtrack a little bit. Freedom of speech, right, as is defined in the Bill of Rights, government shall not infringe upon these. The government doesn't protect those for you. You know, we're protected from the government doing things to interfere with your right to that speech, association, religion, etc. Regarding those too impoverished to afford healthcare, there are systems in place, right? I'm not saying abolish those entirely. We've heard speakers today, you know, say I'm on these or involved in them and speak towards them. There are good programs. I'm not saying go entirely to private. I'm just saying the government should not provide this to everyone. It is not the government's responsibility to decide my healthcare, your healthcare, or a loved one's healthcare. But those in need, there are safety nets already in place.
I had seen a raised hand from Jessica Fair. Did you still have a question, Jessica?
My question was actually asked by my counterpart, Logan. So I'll yield the floor to someone else.
Okay. Mr. Thomas, do you have a question for this speaker? You know what, Mr. Thomas, would it be okay if I call on someone else just because you've asked a couple questions already? Is that all right?
Yes, that's fine.
I see a question hand raised from Mr. Keisner.
I'm just wondering, from somebody that's maybe on the standpoint of the government not providing healthcare, is there room for our tax dollars maybe to go towards the production of medical equipment to maybe drive down the cost of health insurance? I mean, the average OR room, I think, is $62 an hour or something like that. And I'm not for driving down the wages of a doctor or a nurse or anybody like that, but certainly there's room to cut some of that cushion that's going towards Johnson & Johnson or something like that.
That is a fascinating question. It goes back to the first thing I said, right? My background is political campaigns. I know just enough about the topic not to sound like a fool, but now you're dragging me off the topic a little bit. It is definitely something we should consider, whether that is tax dollars going to this innovation or government incentivizing the innovation, right? You can look at problems with our patent system as is that causes monopolies for drugs that should have their costs lowered, right? If you incentivize the research, development, and production instead of incentivizing cornering the market, I think that you're, going to be producing better and more medical equipment, medicine, and everything in that kind of wing. I hope that kind of answers your question.
Definitely, yeah.
I'm going to stretch my boundaries a little and allow a question from Mr. Phillips if it's brief.
Thank you, Mr. Chair. I was just wondering, the speaker mentioned that he has spent time in the past doing both political theory and political campaigns. And I would like to know whether if he were forced by healthcare bureaucrats with PhDs in political theory to either give up political theory for the rest of his life or give up political campaigns for the rest of his life, which would he give up?
Well, joke's on you. I work in higher ed now, so I don't do either.
All right. I'm going to actually stretch my boundaries just one more time. I'm going to allow a question and invite a question from Jody Walker, who has her hand raised. Please go ahead and unmute yourself and address the chair.
Yes, thank you. Mr. Chair, the speaker spoke a lot about the government as though it's some entity outside of us. But in my thinking, we are the government. And if a majority of Americans don't want to see anybody slip through the cracks, then we can devise the kind of plan that is going to cover people And if there are things that don't work, we can change them. But I don't see the government as some evil creature out there who's going to impose upon us things that we don't like. Thank you.
Is there, so is there?
Oh, sorry, the question.
Just a direct question, or Connor, can you take that as a question?
I think so, and if I don't answer it, please tell me. So the government is an entity, right? It's ruled by a majority political faction. So even if that majority is 51%, they rule, right? That means that there is a large batch of the population that doesn't fall in line with the ruling majority. So when you say public opinion favors, or when you say the vast majority of people don't want others to slip through the cracks, is that 90%? Because, still that's 10% sitting behind, and 10% of the American population is a large number. And I don't believe that they should be, dragged by the ear to pay for something that they don't believe in, especially if there are other avenues that have proven effective. I'm sorry, I hope that answers. If it doesn't, let me know.
Or let's have jazz hands for that exchange and all of the questioners, and also my boldness as chair to stretch the boundary once in a while, allow more questions. I just sometimes do that because I sense something is up. There is another speaker that I'm looking for in the affirmative, and I believe one is queued up, and it would be Annette Ritter. If you could go ahead and unmute yourself, and you have the floor.
Hi, my name's Annette Ritter. I'm a first-year Human Services and Addiction Counseling student at Allegany College of Maryland, president of the Peace Club, member of the Diversity Committee and the Democracy Commitment Committee, and also Phi Theta Kappa. The United States government, in my opinion, should provide health care to all of its citizens. And this is why. The United States does not have a health care system. It has a health insurance system. There is a huge difference. I've lived the majority of my life without health insurance. I have needed and received government-funded health insurance. I've been unable to afford and been penalized for not having health insurance. And now through my husband's employer, I have overpriced health insurance for which we pay monthly, then pay a huge deductible, plus ever-rising co-pays, and then on top of that, whatever the insurance doesn't actually pay. I read the article, Healthcare is a Human Right by Mary Garish on the AmericanBard.org site in an effort to understand the United States' stand on healthcare. I was appalled. In the United States, we cannot enjoy the right to health care. Our country has a system designed to deny, not support, the right to health. The United States does not really have a healthcare system, only a health insurance system. Our government champions human rights around the world, insisting that other countries protect human rights, even imposing sanctions for a failure to do so. Ironically, the origins of this right are here in the United States. Healthcare was listed in the Second Bill of Rights drafted by Franklin Delano Roosevelt. Sadly, FDR's death kept this Second Bill of Rights from being implemented. Eleanor Roosevelt, however, took his work to the United Nations, where it was expanded and clarified. She became the drafting chairperson for the UN's Universal Declaration of Human Rights, the UDHR. That committee codified our human rights, including Article 25, the essential right to health. The United States, together with all other nations of the UN, adopted these international standards. Since the adoption of the UDHR, every other industrialized country in the world and many non-industrialized countries have implemented universal healthcare systems. Such systems ensure excuse me, such systems ensure that all persons within their borders enjoy their right to health care. The Covenant on Economic, Social, and Cultural and Rights, the CESCR, Article 12 of this covenant, within their jurisdiction has access to the underlying determinants of health, such as clean water, sanitation, food, nutrition, and housing, and through a comprehensive system of health care, which is available to everyone without discrimination and economically accessible to all. This treaty was signed by all UN countries. It was ratified by all countries except for 3: Palau, Comoros, and the United States of America. The only progress that the United States has had to report in 2015 was the Affordable Care Act, a health insurance law, not a healthcare law. The United States could not admit to the UN that it had made no progress on so basic and fundamental a right as health. Unless and until the United States lives up to their promise to implement these international standards, we will be shackled by an ineffective and deadly health insurance system. The US government must stand with the other United Nations countries in ratifying the CESCR treaty into law and recognizing health care as a basic human right that must be honored. Thank you. I give it back to the chair.
Thank you, Annette. Quite a few hands are raised. I'd like to first recognize the questioner, Hope Jeffries. Can you unmute yourself and if possible, show yourself on video if that's okay? I do see a hand raised from Hope. Yeah, go ahead. There you go.
Okay, thank you, Mr. Chair. So my question is for the previous speaker. Does the previous speaker feel concerned that with the universal health care, that the quality of the health care will decrease by the increased utilization of the health care, people using the insurance, more frequently?
You're muted, Annette. You need to unmute.
The person in, what is it? The speaker was asking about health insurance.
Oh, we've lost your voice. We can't quite hear you.
Okay, I'm sorry. I'm speaking health care, not health insurance. I do believe that a government capable of doing all that it's done is also capable of doing it fairly. Just because we have not done something in the past does not mean we can't do it in the future. That's my answer.
Thank you for that. I'd like to open the floor to Rebecca Vardaman. Go ahead and unmute yourself.
Thank you. And this has been a great debate. Thanks for it. And I just, while I actually agree with the speaker, but I always have this question I wanted to ask earlier, whenever we start talking about other countries, because I do think we should learn from other countries. Why do we always feel like we have to create the wheel ourselves? But my question is, usually these countries are smaller than us, smaller population, smaller just region area. And so does that make things different for us, that we just really are so much larger than most of the countries we're being compared to? Thank you.
Okay, I'm no expert. However, if all the other countries, United Nations that signed the treaty and ratified the treaty, except for the 3, I'm quite sure the other countries, there must be quite a few of them that are at least as large, if not, I think we make things so much more complicated than what it needs to be. I really do. I think something as basic as healthcare needs to have a much more basic answer. This whole system that we have is totally broken. Everybody knows that. You can't just keep slapping Band-Aids on an open wound. It's not gonna work. We've got to do something different. We've got to do something drastic. And we can't just sit here and debate about it forever. They need to get up off their asses, do what they're getting paid for, and get shit done. Excuse me.
We don't have any language decorum restrictions in Braver Angels debates, as far as I know. And so that's perfectly fine. Many hands are raised, and we're at a point in the evening where we're going to open it up to the floor now. And so I want you to keep those hands raised. And, you can address a question to the previous speaker or even any of the other previous speakers. But I'm also going to invite people to come in and explore the nuances of the resolution. And you may have heard things that you agree with tonight. You may have heard things that you disagree with, both in the same stroke. So, we can speak to the nuance of this topic. It's very complex. There's a lot of minutia and depth to it, and we want to explore that and invite the community to speak. I had seen a question, though, a raised hand from Joshua Hershey. I'd like to recognize that, and if you could unmute yourself and also turn your camera on, that would be helpful.
Thank you, Mr. Chair. My question is for the previous speaker. I do have a question. The previous speaker talks about the experience with different kinds of health insurance throughout the speaker's life. My question is in regards to coverage specifically. A single adult making, say, $35,000 a year isn't going to qualify for state insurance, but would have to pay out of pocket to be seen at a specialist, say like a dermatologist. I believe a hallmark for people without insurance is ignoring medical problems that they currently have or think they may have. So my question to the speaker is, where does the speaker believe the line should be drawn between, in their experience, what should be covered under a universal health care plan as opposed to different health insurance plans?
Okay, Annette.
Okay, thank you. That's a great question. To me, to so many people, especially in human services, I think health is not just going to the doctor for a sore throat. Health is mental, health is physical, health is spiritual. It's the whole body. It's the whole body, not just parts of it, not just this, not just that. It includes your teeth you need to chew with. It includes your eyes you need to see with, your ears you need to hear with. Those are not something that should be forgotten about and considered. You don't need it, because we all need it. We need mental health. We need help with everything. Face it, people are sick. People are sick, the government's sick, the whole freaking world is sick. And healthcare should address the whole person, not just a piece of it.
Thank you for that. Again, so with all the hands raised, I'm going to invite either a question for the speaker or a question for previous speakers or your own statement. And the statements can be, let's say, between 2 and 3 minutes. I want to allow as much time and opportunity for members of the community and the student groups here to express themselves along the contours of this topic. A hand is raised by Noah, and I would ask you to unmute yourself and turn your camera on if you can. Go ahead, Noah.
Thank you, Mr. Speaker. I can't turn on my camera. I'm actually getting ready for work right now.
No problem. We get you.
That's a little more private than everybody needs to see.
We respect that. No worries.
My question, obviously I work night shift at a skilled nursing facility. One of the things we see is a lot of abuse of the care plans that are in place now for people that aren't covered by private pay. How would some of the previous speakers or the Assembly's general suggest that that be addressed with universal health care? Thank you.
Are you still with us, Annette?
Yeah, I wasn't sure who the question was really addressed to, so I was waiting.
Okay.
There's abuse on everything. That's been a big argument on welfare systems, on everything. You know, people are so concerned about the people abusing it. My God, the government's been abusing everything and abusing us along with it. That's the least of my concerns.
All right, now I'm going to just invite speeches on the topic, as much as to whatever extent you can muster that. I see a couple of hands raised. For instance, Mackenzie Simpson, you have a hand raised. Would you like to chime in on this topic?
I don't know much about the topic. I'm very young. I'm a freshman at AC, so I don't have much experience with this. I just know what my parents both have very well-paying jobs. My dad has private healthcare insurance that me and my brother and my mom are all covered under. And my brother last year actually had to have 2 knee surgeries done. And just because they pay an extraordinary amount each month for this, they still had to pay an extraordinary amount after the deductible was met and after the health insurance they did pay for what he needed, but it just wasn't enough. And I just don't understand why you pay so much for it, you put so much into it, and all of your money goes to that, but they can't, in a time of need, pay for what needs to be paid for. And it was just very upsetting. And it was really, hard on my family, especially during COVID, because my mom, stopped working. And it's really upsetting. Thank you.
Thank you, Mackenzie. Really appreciate that. I'm going to recognize the floor, give the floor now to Alexis Castell. You want to go ahead and unmute yourself?
Hi, can you hear me okay?
Yes.
Okay, thank you. I'm not sure how to address a previous speaker. It was Speaker Isidore Johnson in particular.
He left us, unfortunately, but
Oh no. Okay.
Yes.
Well, still to you and to any of the other presenters who would have something to say in return to this. His opening statement, his point A was that our government would not handle universal health care coverage very well. And that was his opening statement for why we should not be universal health care forward. And I feel like that says more about how America needs a more proficient, able, and diverse government than it does towards, or it says more than it does about us not needing that universal health care. So I wasn't sure if somebody could clear that up for me or if that was just poor wording on his part.
Well, I don't know exactly, Luke or anyone on the whipping side, how we would handle this because Mr. Isidore had to leave and is no longer able to answer. So
seems to me that this fits pretty well as a speech on the topic. And if any forthcoming speeches on the topic want to address this, that might be a good way to do that.
I thank you, Mr. Phillips, for that wisdom. And I'll recognize Vicki Stevens. There's quite a few hands raised and we're going to get to them. By the way, there is no deadline. There's no time end here. People can stay as long as they want. I want to make sure that the floor is given to everyone who wishes to speak. Just try to keep your comments to like around 2 minutes if you can.
Okay, I'm still not sure exactly where I stand on this issue. Being in the medical field, I can see both sides, but the one side that I struggle with on a daily basis is when I'm working with patients that I'm a diabetic educator. And it's extremely frustrating when we have patients that can't get coverage for insulin or they're struggling to get insulin coverage or even devices that can help them stabilize their blood sugars and prevent those long-term complications. Like continuous glucose monitors are something that is coming, that we're seeing more and more every day, but insurances have, like Medicare has such strict stipulations onto who can get those if they're not a type 1 diabetic. they have to do so many finger sticks a day. They have to be taking so many insulin injections a day. But to me, regardless, diabetes is a disease that not a lot of people realize, that it has so many long-term complications, that if they could just provide these quick results for that, then we could prevent all of those. So that's where I struggle with this, is that I struggle with it with my patients, and that's what frustrates me with it. Thank you.
Thank you, Vicki. Chair would like to recognize Tom Bowling next. Go ahead and unmute yourself. Oh, you're still muted, Mr. Bowling. There you go.
Okay. First of all, I would like to thank all of the organizers of this event and everyone who has spoken. I look at this through the perspective of a father, and I think about my 5 children and think about the decisions that they have made about their careers. And I don't want to live in a country where individuals' human potential is, and their choices about a profession and their way of life is predicated on whether or not their employer can provide health insurance. That I just see a loss of potential. I see a loss of growth when decisions about how you spend your time and engage in what you want to do is somehow compromised if an employer is not in a position to offer health insurance. And that connection between employment and health insurance needs to somehow be broken.
Thank you, Mr. Bowling. I had a chat message from Ray Morris. Did you want to unmute yourself and say a few words?
Yeah, thank you, Doug. I hate to leave, but I'm going to have to leave. But I just wanted to, again, thank you all for letting me participate in this and listen to everyone. Some great perspectives. I think this is exactly what we as a country need, is we need to have good civil discourse and good conversations about all of this topic and many, many others. I like, quite frankly, the honesty of a lot of people who came out and said, you know, I don't know everything I need to know about this. And I think that's true for a lot of us. It's true for myself, you know. But I just wanted to thank everyone for their comments. And I wanted to say this, you know, even after your education is done in your college, please remember that, you know, you never stop learning. Learning is a journey throughout your life, and anytime you can participate in discussions like this and keep your mind open to the different thoughts, I think it's very important. But that's really all I had, Doug. I just wanted to thank everybody for letting me participate in this and how much I enjoyed it.
Oh, Ray, we're grateful for you saying all that and for being with us tonight. You're all part of a movement here that's happening all over the country, and having you with us really added to the evening. So thank you for spending time.
Thank you. Good night.
Yeah, thanks, Mayor. I wanted to say also, there is a community group that's trying to get organized here to bring community members more into this Braver Angels project. So we'll continue to work on that together.
That sounds great, Alicia. Thank you. Good night, everyone.
Good night.
I have a number of speakers I'm going to recognize with, give them 2 minutes on the floor here. There's quite a few. As I do that, I'm going to invite Mr. Lassa to put in the chat his information about the hustings, which is a wonderful publication. And he's actually documenting what takes place tonight. in the center of the resolution and the pro and the con of it and everything along the spectrum. And it'll be a nice bit of shelf life for this event that he's documenting with that very fine publication. So he'll put in the chat links to it, and you're welcome to follow up with him, and we encourage you to do so. I'd like to recognize the person with N bearer, if that's okay. I'm sorry if I'm not saying your name correctly, but go ahead and unmute yourself. And we're not hearing you. Now, if you're having problem with your mic, it seems like you're unmuted, but we're not hearing you. You might, I'm going to go on to another speaker. You can change your settings, or sometimes it helps if you leave the debate, come right back in, and maybe your audio settings will be corrected. Sorry that we can't hear you, but we'll give it a shot. We come back. There is a speaker raised. There's a speaker whose hand is raised. Maha, M-H-A-W-A. Apologies if I'm not saying your name correctly, but please unmute yourself and go ahead. And if we can see you on camera, that would be helpful.
Hello, everyone. I'm sorry, I can't put my camera right now.
No problem.
But yes. Actually, it's not really a question.
Yeah.
It's like an event about my family, my mother. I'm from Africa. I have a family that lives in France, and my mother goes there almost every 6 months to get a free health care, and she really does not pay anything. And I live here with my 2 kids. Myself, we pay like almost $700 a month. And for me and my kids to get a proper medical, thing. So I really never understand why America, being like one of the best country in the world, that if you cannot afford medication or something like that, you may, like, a lot of people cannot really afford that. Like, for example, for pandemic, I had the corona, and then because I couldn't go to work for a couple months, I'm still paying for that backup medical bills, which I never understand, So that's all I just wanted to say.
Thank you very much for that. Jazz hands for the speaker. I'll recognize Mr. Zach B.
Thank you, Mr. Chair. First, I want to say this was really awesome. Lots of excellent voices and opinions, and I really had a good time listening. And I'm a therapist. I've worked in agencies. I've also worked in private practice, and I work in private practice now. And to my unending suffering, I take insurance, and it's just incredibly painful on my end for many different reasons. And when I'm hearing a lot of these arguments about why we can't do it from an economic perspective, or from just not being able to trust the government to be able to figure it out, it feels very fatalistic to me. Like the soul of America going all the way back is that we did figure out a way to set up our government and our population so that we could actually have this democratic society, right? We were able to have that revolution, right? Can we do that again? Or are we just sort of doomed to not be able to come up with solutions to these kinds of problems? And I say that even though I kind of agree with some of the moral arguments, like, is it a right? To me, that argument, it's really interesting to have, but you can kind of just run in circles. You either believe it's a right or not. And I don't know what the answer to that is. I don't know that there is an answer to that, but where I eventually fall when I'm thinking about this issue is on tactics, right? Which maybe sounds kind of cold, but tactically, do we want our country to be full of people who are really competitive and will bring great wealth of ideas and other types of things to the world? Are we competitive with other countries, right? When we think about how the government is supposed to protect us, right? Going back to an argument that some other people have made, is there a way that we can protect both the right to choose what kind of healthcare you want and protect us in a more abstract sense by making a healthy population that can continue to be, a world leader? Or again, are we sort of doomed to fall down this path of fatalism that we can't do this, right? So this isn't to say I have an answer to which way we should go, but it is to say I believe that we can figure it out if we get our butts moving and really think through this and think about how we can make our country one of the best countries in the world.
Terrific sentiments. Thank you so much, Zach. I'm going to try again with N. Bearer. Oh, goodness. I'm so sorry that you're having trouble with your mic. Keep on it. If anyone can help her of the whips, I'm not sure what we can do at the moment. But I'll call on Tina next. I see you have a hand raised. If you can unmute yourself.
Hello, can you hear me?
Yes.
Yes, so I have enjoyed the debate so far. My concern is I had an uncle who was diagnosed with cancer. He had health insurance, but I guess it wasn't the right health insurance. So he couldn't get the proper treatment like at those big hospitals that specialize like in lung cancer. He couldn't go out of state because of his insurance. So I'm just trying to figure out how could we, as a country, as a government, make it affordable to everyone to get those treatments that's necessary to live, And thank you. That's all I have.
Well, thank you, Tina. That's so brief and there's so much in that. And it just adds great presence to the debate when people are talking from personal experience. And what you're speaking about is being echoed all over the country. Thank you for that. Hope Jeffries, you have the floor next. And there's quite a few others I'll recognize after you.
Thank you, Mr. Chair. So I don't have a lot of experience in the stuff, but I have worked in healthcare and, in the pharmacy to know enough, a little bit. And so my concerns with the universal healthcare is, well, it might, help people that are really in need. It also opens up the door for people to use it, I guess, more than they should, to take advantage of it, which in turn, could ruin the quality of your care. Like, for example, if you're in the emergency room and say there's 6 people in there for hangnails and somebody comes in with a major problem, well, they don't have room for you. So I just have concerns that, people will abuse it and it'll make it more difficult for the people that need it. And also, the more that it's used, the more the costs are going to go up. And eventually they're going to have to find somewhere for that money to come from. And are they going to take it out of our taxpayer dollars? And that's all I have.
Thank you, Hope. I'll try N. Bearer one more time.
Is it working now?
Yes, we've got
Okay.
you. Yay, jazz hands for the microphone working.
I just wanted to start by saying that I think everyone made great presentations today and made good points of views on everything. And it definitely makes you think that and wonder if there is something that we can do. I definitely agree that there should be healthcare set aside for people who can't afford it. And coming from a family that couldn't afford dental insurance, I understand how the government needs to expand their healthcare to other things other than just hospital visits and stuff like that. But I also think that if we give everyone the same insurance, that the lines for hospital visits and doctor's visits are going to go through the roof, and you're going to be waiting months to years to get in. And people are just going to abuse it and use it for things that they don't necessarily need to go to the doctor for, but know they can just because they have that insurance covering it. Thank you.
Thanks so much. I'm so glad you were able to unmute yourself, Jazz, for that. And Abigail Shepard has the floor next.
Hi, can you all hear me?
Yes, we can.
All right, so I just wanted to start by saying I don't know exactly where I stand on this issue because being 20 years old, I've always been under my parents' insurance. I personally have never been denied any kind of care, and I don't know what that would be like. So I'm fortunate, and I understand that if my circumstances were different and I didn't have the parents I had with the jobs that they had, I think I would think about it a little bit more differently. Just yesterday, I Googled how much it would be per person, like a month, if I didn't have my parents' health insurance. It was like $500 a month about. That's like rent for some people. So if I was on my own and I had nobody else to rely on for that, I don't think that I could afford it. With that being said, I have my dad's vision insurance, so I get a free pair of glasses once a year, but I don't even wear glasses. So I guess what I'm trying to say here is people complain about if the government did provide this healthcare for everyone, their taxes would go up, whatever. But people are already paying into this anyway. So like for me, I don't need glasses. Why can't that pair of glasses go to somebody who needs it? Because the tax money is already out there. And I think it comes down to people wanting to help people, essentially. So that's about it.
Thank you, Abigail. It's wonderful. I'm going to give the floor to Ashley Kessner next, and then Sophia.
Hi.
You got it.
So it's been a very interesting discussion, but earlier a point was made that if healthcare should be, if it's a right or if it's a need, which I thought was weird. But anyway, so I think if you think about the negatives, if you don't think your money should go to something you disagree with morally, then you need to think of what the money will go to, like cancer treatment or mental health awareness. There's people like kids that are sick, pregnant women that can't afford their treatment. You can't just think about the negative sides of it. It would be my point. I think her name was Greta, to point out for that. I think it's important.
Very fair game, and I'm going to bring it up. I'm not sure if Greta's still here, but again, it's a testament just to the format that we're using to enable all these voices to be heard, and actually without shouting each other down. So at least you can recognize we've got quite a diversity of viewpoints in this country, and the mess that we're in is like we're so tangled up in fighting each other on stuff that we disagree about instead of listening to each other. And you did that tonight, and we heard you. So thank you, Ashley.
Thank you.
I said I would recognize Sophia next. Go ahead and unmute yourself. And
Hi, can you hear me?
we can't see you, but you don't have to turn on your camera if you don't want.
I'm trying to get out of here at work. I'm at work and I'm trying to do homework and work. But no, I'm going to agree with the last speaker, Miss Annette. Our healthcare system for the U.S. to be the richest country in the world has really gone to hell in a handbasket. It's a shame that we can't provide healthcare for everyone because I think we can well afford it. the fact that I have to pay to go into, to do the marketplace to get health care for my daughter is expensive at work. It's too expensive for me to even pick up at work. But for me to have to go into the marketplace, get the health care, it's overpriced. And not only that, the deductible is super high. And then on top of that, when you do, if you use it, because we don't, but if you use it, it's still, you still having to pay that copay when you go to the doctor. So all of that money, the monthly payment, the deductible you're having to meet, and then on top of that, the copay that you have to pay, and then the whatever medication you get. And I don't understand why I'm penalized for it every year, or each citizen is, for not having it during tax time. That's one of the questions they ask you. If you have health insurance, if you don't have health insurance, you're penalized. Why is that? Why don't you provide it for everyone who can't afford it? And, you know, so that we won't have to, you know, be penalized for not having it. So that's my take on it.
Thanks so much, Sophia, and thanks for making time, even as you're in a hurry to get off to work, to your job. We really appreciate you staying with us. I had a chat message. There's a few hands, still some hands raised. I'm going to recognize all of you. There was someone who couldn't raise a hand but wanted to speak. Colt McDonald.
Yeah, thank you, Mr. Speaker. Can you guys all hear me?
Yes, yes.
Okay. Mr. Chair, I had a question for any of the previous speakers that were in support of the topic.
Great.
My question is, and I first have an analogy. We have McDonald's, and they're a chain restaurant, and they're all almost equal, almost the same. You can't go out of the chain. They have rules and restrictions. But we do have restaurants that aren't in chains, and they're able to experiment and try many different kinds of wonderful foods and make our life much more interesting. I kind of compare that to the universal healthcare system. I guess my question is, there's clinics that are high output and there's clinics that are specialized. And if we have a universal healthcare system, are we going to have those specialized clinics, those clinics that maybe have doctors that are much more capable of performing different surgeries like heart surgeries and that? So by doing a universal healthcare system, are we giving up our ability to push our limits, to try new things, and have better technologies to have better percentages of lives being saved?
Well, are any of the speakers in the affirmative still with us? I know Jessica's still here and Annette. So Jessica, go ahead.
I think you make a great point, and just this actually echoed one that was made earlier about, you know, sort of like the trade-off. Are we going to take, you know, a more equalized route, or do we want to, you know, keep incorporating the diversity of trades and practices that keep, you know, the democracy flourishing? But what I would say is that with implementing a universal healthcare system that incorporates a dual option or an opt-in, opt-out system, those private practices, those private insurers, the doctors that have their typical patients, they're not losing any of their feed. The people who can afford healthcare are going to continue to buy the most highest quality that they can afford because they simply have that ability. The implementation of universal healthcare is going to give people an option now that don't have an option. So they are not going to be funneling into any system that they weren't already a part of. And on the contrary, the people who are already a part of the high-paying private insurance specialized systems are not going to decrease their level of care to a basic coverage that now everyone is receiving. So I think, as my counterpart Delaney mentioned earlier, there sort of are these two different arenas, but the universal healthcare is sort of bringing them all to the same playing field. But great question.
Thanks, Jessica. So Whip's reality check for me. There are a number of speakers who are eager to put a speech on the table, and I'd like to recognize them. Is that okay if we proceed?
That sounds good to me. Would you like to let everybody know when the evening is going to be ended as
Yeah,
well?
I mean, see, this is just one of those remarkable debates where it's just overflowing, and I don't want to cut anybody off, and that's good. That's a good problem to have. I mean, no one was forced to stay, and we have quite a few people still with us. But I think we'll at least ask. I'll deal with the remaining raised hands, and then we'll ask if we can, stop after that's done, and then just do our debrief with whoever is left. I'd appreciate it. I'll recognize Kabanga Nasaya next.
Hi, I have a question about Obamacare.
Go right ahead.
So I was asking, does Obamacare usually help people? Because most people always complain about it.
Wonder if anyone has a rejoinder for that.
Mr. Chair?
Go ahead, Luke.
I don't know. I really, literally don't know, because I hear a lot of complaints, and I also hear a lot of support. I feel like there's some complexities in the way people experience it and use it based on employment situations that might be good sometimes and might be hard other times, right? But like all policy questions and all policy programs, it's an attempt to make a universal result, or make a general system of way things work. And human life being as messy as it is, sometimes you get good things, sometimes you get bad things. I think that just means that it seems to have been influential. Whether that means it's successful on the merits of those who designed it, I'm not entirely sure. I think we'll be debating about that for decades. But it certainly has been influential, which not all healthcare programs can claim to have been. So
I'll recognize a statement from Alexis. Go ahead.
Yes. Am I still addressing you then, Mr. Chair?
Sure enough.
Okay. I'm not really sure how the proper way this works. So I have two statements, I believe, in one, both of them pertaining to Greta's argument. I did not necessarily agree with all of the implementation of her religion into the politic. I feel like there's time for religion, and there's time for politics and policies, and there's time for rights and wrongs. But when it comes down to the basic necessity and the rights of humans, that's not, religion doesn't belong there. It's who deserves, if somebody, I am anti-abortion, but when it's medically necessary, or in terms of, unfortunate incest or rape, that is a mother's decision at the end of the day, and I will respect and honor that woman's decision. However, if my money and my taxes were to pay for anybody to have help in any way that they may need, whether that be a child having their leg amputated due to diabetes, or a mother who was raped because a convict was let out of prison on good behavior and now has to abort a child that she doesn't want to have traumatic flashbacks and reminders to, whatever their reasonings for, I am in support of helping somebody better their life. That is health across the board from any way you look at it. So I didn't really appreciate where she was trying to, I understand where that speaker was coming from. I just don't think that it was portrayed properly. And I also respected Mr. Logan Carlisle's comparison to the bridges, where he was, all of our taxes are going to things all across the board. We are paying for police officers throughout this, the BLM movement, and trying to defund the police, but we still pay for, police matters. We pay for schooling, we pay for deforestation, we pay for roads and bridges and destruction of properties that we never have a say in, but our tax paying dollars go to all of these things. And that's just the beauty and the pain of being an American. And it comes down to whether or not the pros outweigh the cons. And I think in this case, it would.
Thank you, Alexis. And, Ms. Wagley's left the gallery. She's no longer here to respond. And, the only thing I can say to it is that, there are millions of Americans who share her views, and
I know,
we have to deal with, and that's why we have these Braver Angels debates. It's like one of the only forums where we can really engage with each other in this manner. And I appreciate you bringing your sentiments to the table. I have hand raised from Mindy, and then Brent, Marissa, Logan, and if I miss anybody else, I'll get to you. Go ahead, Mindy.
Hi, thank you, Mr. Chair. I just kind of want to just state my feelings on why it's so important to have the universal health care. Most of it is save lives. You know, there are so many people, me being a nurse in a family practice, there's so many patients that can't afford health care. They delay going to see a doctor, which therefore leads to other diseases. If they had the opportunity to come to be checked out, early symptoms would be caught, the patient could be treated and delay anything else or stop anything else from happening to them. Another thing is nobody really said anything much about equal treatment equality. That is such a big thing. There are so much stuff in this country right now, so much inequality. Can we at least get the same healthcare for everybody so that we're all equal? There's no, this one's better, that one's better. Let's be equal for once. That's how I feel, you know? And I feel like we are paying our tax dollars now, you know, for Medicaid and Medicare, which is great. It helps those people out. But again, I want to go back to the working class. You know, we're paying the high premiums for insurance. Our tax dollars are not only going towards that we have to pay into, but then other things too. And then when it comes down to it, medications aren't being covered. You know, when I have a patient telling me, well, I can't afford my meds, so therefore, instead of taking daily, I split them in half and take half daily or every 3 days. That's not helping their health. That's not. So I'm a big advocate for patients. I find ways to help them, the middle class of working that's paying high premium for their insurances, to get better deals on medicine. There's so many, all the pharmaceutical companies, they have patient system programs. People, they're not aware of this. They'll get you on a payment plan based on your, you know, your monthly income. There's also a site that I'm a big believer called goodrx.com. Anybody can use it. You could upload an app to your phone. You could put in the price of your medications that you're paying, that high cost through your copay through your insurance company, and you may get it for $10 at Walmart, you know, $10 at Rite Aid or whatnot, where your insurance company, you're paying $54, $60 just for the copay. I feel like the middle class, we deserve that break to get that universal health care. Our tax dollars are going, I'm a nurse and I still got to pay so much money. Thank you, Mr. Chair.
Thank you. Sorry, I had to ring the bell on
That's okay. That's okay. Thank you.
time for people. I hate
Okay.
doing that. Thank you so much. I want to recognize Marissa, then Brent, and the others who are left. Go ahead, Marissa.
Thank you, Mr. Chair. Just a few things I kind of just wanted to point out from the political view of it, you know, the whole right versus the need and whatnot, but yet politics is what decided about COVID, who gets to be tested, who gets to have the vaccine, also the mandation of it. I mean, some of us who want it or don't want it don't get to keep our job as nurses because, oh, well, you have to have it in order to work in this field. Well, there goes my job because that's what I do. I'm not me personally, but I'm just speaking for nurses that I know, or those that, you know, it's against their beliefs. And when I goes to Greta's religion thing, well, it goes against my beliefs and I don't want to take it, but yet my job is forcing me to get it, or because the government is saying that I have to get it. Another thing, you know, they're talking about, well, private pay gets it over those who have to do public pay. Not necessarily, because in us nurses and doctors, what we look at first is not so much of a stub nail, ingrown nail, whatever it was that the statement was. It's your ABCs of life, your airway, your bleeding, or your circulation. That's what we look at. You're not able to breathe. It doesn't matter if you came in first, second, or third. We're gonna look at who's gonna live first and who's gonna die first, and what we can save. That's what it comes down to. Another thing is, you know, we can't invest in a good healthcare system for everybody, but yet we have this CARE Act that we can hand out money like nothing because everybody lost their job due to it. That makes no sense. Where's the, sorry, my son decided to come in and join. Son, go over there. Sorry. going off of what, Greta said about the whole, well, I don't agree with the whole abortion deal, but yet Oregon allows for providers to help with elder suicide because they are no longer capable of caring for themselves, and they don't want to live that kind of life where people just see them suffering and they don't want to suffer anymore. So where is the differential there? Let's see.
So could you come to a conclusion, just because I want to make sure?
Yes, I mean, basically, it's almost kind of a damn if you do, damn if you don't. That's really what it is. And going off of what previous speaker Mindy, the middle class. I mean, we have this huge. It doesn't matter. I honestly, as a nurse, advocate for patients. I don't care. Let's just get the help. Just get the help. That's all there is to it. Like she said, equality over quantity. That's what it is. Thank you,
Marissa. Thank you so much. Jazz hands. Alicia and Luke and Diane, I want to just wrap this up with there's a couple more hands remaining. Is that okay if I go to Mr. Thomas next and then HSAC, and we'll do our debrief after that, if that's okay.
I'm with you, Mr. Chair. Do as you will.
Okay, go ahead, Mr. Thomas, unmute yourself for a minute or two.
Okay, I'll make it brief. So just from this debate, I've kind of taken things from looking from the outside in now. And a lot of what I want to say is that I think what it comes down to is actually a right. This could be something that could be a constitutional amendment with healthcare to make sure that we are granted, regardless, that we are ensured that we are covered, or we can get healthcare regardless. That might be an option. Not really an answer, but the other thing I want to say is that most of these developments come from government funding or from government programs. For instance, Wi-Fi, what we all are using right now. The famous movie star Hedy Lamarr actually come up with an idea to jump radio frequencies to help block jamming during the war. Well, later on, that was developed by our government, and they kind of worked with it. Eventually, other companies picked up where the government left off, and they developed Wi-Fi. So a lot of our developments actually start with the government, and then when you have private companies, they do help develop. But ultimately, we would have come to the same thing eventually. And so a lot of my perspective too is also with like death care. A lot of people are dying because of treatable diseases. And so that's kind of where I'm coming from. I don't want to see someone that died because of diabetes because they didn't get insulin, and I'm just all about fairness. And it's one of those things where I just believe that we shouldn't see people die from things that are not car accident, a shot. That to me is just really depressing to think that person died so young or at a certain age because they lacked the inability to get that medical care. So, and really it's just kind of helped me understand a little bit more too, both sides. So it's been a great experience with everybody. And honestly, it's been fun asking questions. So I give you back the floor.
Really appreciated all your questions and statements tonight, Brent. Thank you so much. I'm going to give the last formal speech or statement of the debate part, and then we're going to go to a quick debrief. And I don't have to be Mr. Chair after that. So HSAC, can I give you the floor and unmute yourself?
Thank you, Mr. Speaker. Let's see, trying to do the camera, but it's not looking like it's going to work out. But can everyone hear me?
We can, yes.
Okay, thank you. Kind of to caveat off the last previous speaker, it's been very formal. I mean, it's been very informative because I am not one who knows much about healthcare either, unfortunately. What I can say, I've liked to hear both sides of the argument, especially when we go and look at different countries and everything. The only skepticism I have for looking at other countries is our population size versus theirs when it comes to universal healthcare. That's my only concern on that it would take us longer, I think, to get that in place than versus the privatized. If we were to focus on the privatized, to maybe try to focus on that first and then slowly move towards a universal. But it's been a pleasure. Thank you.
Thank you so much. I'm going to make a motion that we adjourn the debate and move to our very quick debriefing session. If someone would like to second that motion.
Seconded.
All right. With that, I am now Doug Spry again. I can let go of the mantle of being Mr. Chair, which is a relief to me because all throughout the evening, I wanted to jump into this debate myself. I was really moved by the vast perspectives that were shared tonight. And my question for everyone here is simply, is this kind of an evening worth it? A lot of people, we had almost 90 people show up and most of them stayed for quite a while. Gradually, it started to die down because we're here. This is the longest one I've ever done, Luke. This is 2.5 hours.
I was gonna say, Doug, I've normally, like in the national ones, like there's a hard time limit, and so I love that here in the college debates situation.
I just don't have the heart to cut it off, you know, and that's a big, huge kudos to Allegany, Frostburg, and Allegany College of Maryland and Frostburg State and everybody who helped organize this. I mean, it was just fantastic. But I want to ask, you know, everyone here, chime in now. Like, is this type of dialogue and discourse and engagement with each other valuable for the country? What would you say to other college students who know nothing about it? Tell me what the experience is like. And I'd like to start with Logan, has a hand raised, and I'm just going to call on people if that's okay.
I definitely appreciate it. You know, as a 20-year-old college student, there's definitely a demographic of political opinions that I'm, you know, exposed to amongst my peers. And a lot of the opposite opinions to my own are, I feel like, sort of shouted at me on, you know, some TV is playing like Fox News when I walk in, that's, you know, sort of just aggressively like attacking my argument rather than, you know, proposing a counter argument, which, you know, I'm 100% open to counter arguments. And I admit that even though I'm, you know, for government provided healthcare in a moral sense, there are definitely more like legal and like technical arguments you can make against it. So I appreciate, you know, Braver Angels for definitely providing a platform for, you know, again, ideas to be discussed rather than, you know, ideas to be dragged down or attacked.
Thanks so much, Logan. And Whips, Alicia and Diane, please help me, you know, call on people, or just, you know, if I don't see anybody, I'm just kind of going around the checkerboard here. Melanie, how was the evening for you?
Well, I think it's interesting to hear all sides. Now, granted, I do lean towards providing universal health care. I do have private insurance currently because of my husband with work and everything, and I'm very thankful for it. I know if we would lose our health care, my health would probably deteriorate pretty quickly, and I would have to change a lot of my medications and things like that. If I didn't have insurance, I would pay over $5,000 a month for just one of my medications. So I think there needs to be something in the larger realm that needs to help bring those overall costs down, so that as someone who's like me that needs this type of medication can afford it and not have to put other things in jeopardy to do things. So there needs to be working on a lot of different areas. And here in this discussion, at least there's a lot of people trying to communicate to try to bring those ideas together.
Thank you so much. Diane, who do I go to next? I've got.
How about Annette?
Well, Mr. Keisner had his hand raised, and then Annette after that. How about that? You're on mute.
Okay.
There we go. This was definitely a night well spent for me. I think these debates are important, and especially to hear both sides in a debate format where we have somebody that's, you know, like the chair. You know, all too often people just shout at each other. They don't get to hear the other side's point, where they're coming from, the reasons why they hold those beliefs. They don't try to approach it from an educational standpoint and counter those. So, you know, I thank the position of the chair. That's That was awesome. And this was very cool to have a debate where we got our time to talk.
Well, thank you so much for that. And the chair thanks Braver Angels and April Lawson, the architect of these debates, and my colleague Luke and others on the leadership team that I'm with every week. And, you know, for teaching us how to do this, how to conduct this in a certain way. And, you know, I want to emphasize again, you're all part of a movement of students. You know, this is the 13th debate this year that I've chaired or been organized on with college students in different campuses, and there's many more to go in 2021. This one in particular is going to be very memorable for me for a lot of reasons. And you know, I can't even express it right now, but I just want to tap the sentiments here and make sure that, you know, we get everyone to share what that experience is like and really help other students experience this for themselves as much as possible. That's what we're trying to do. So thank you for that. I said that I would, I said I would go to Annette next, right, Diane? Okay.
Hi, I've really appreciated the diversity on here with all the different ideas and different places. Nobody knew what the other speakers were really going to say, and yet everyone came up with a slightly different take on things. And we kept it mellow, you know, people didn't like, as much as we might have disagreed with some people, nobody attacked. And I think that is awesome. That shows a great deal of respect from everybody that's involved. I just want to say two things about the United States said that they signed a treaty. They just didn't ratify it. We have already promised to give this health care. And I think it does a disservice and underestimates people and our ability to create and to give and our genuine reason for getting into healthcare in the first place when we try to assume that doctors and physicists and scientists are not going to work just as hard to create things to help people live. I mean, what are we thinking? All they want is the money? Is that why we're all here? I don't think so. I think it's bigger than that. And I think we need to look past the politics. We need to look at the people.
Oh, thank you so much, Annette. Whip Alicia.
I just wanted to jump in and say that this has been a tremendous experience. To me, you know, I was wondering, because we do a lot of dialogue and deliberation work, what this debate experience would be like from, you know, my own presumptions about what debate meant. And I think there's a different format here that helps. I mean, there's some structure, which is always what's helpful when you learn a different approach, is there's, you know, it's not just something we assume everyone is good at, or, you know, it's a soft skill, we've got it. You got to learn some different approaches. So I'm glad we are learning this one. And I just think that, you know, you realize there aren't really two sides, you know, I mean, there really are more, and that, you know, the nuances of the different ways people think about things, you know, comes out even in what's framed as affirmative and negative. So we're going to try it again, you know, so I hope that, you know, others will show up, you know, and join us next time we do this.
And there will be a next time. One of our strategic goals in this team of college debates and discourse is that we want to enable students and faculty to do this themselves, not be dependent on us. Mm-hmm. And I hope that you've had an experience tonight that really is a big step along that way for you. And we're here for you to in any way that you need us.
Great.
Yeah. Anyone else tonight as we wrap up? Jessica.
I just wanted to say that this has been absolutely amazing. The debate team conducts these types of debates on a much smaller scale, bi-weekly, and it's always really awesome. A, because we assign sides, so you're often arguing for a viewpoint you disagree with, which teaches you a lot. And B, just because you learn so much by ignoring the stereotypes of what people tell you and actually investigating the topic on your own. But I know we've ran over, so I just want to leave you with these two notions. I think if there's anything we can take away from tonight, it's that we don't always have the answer, right? Like these questions are not supposed to be solved by just one of us at just one point in time. There's a lot of different factors that go into it. And there's a lot of different perspectives that all mean very different things for the same issue. So when you're looking at a complicated issue, a divisive issue, one that you disagree on, one that you agree on, ask yourself first, what unites us? Because you will find that there are more things in that category than what you initially expected. And secondly, how far are you willing to go for what divides us? So how far are you willing to go to stand in the next person's shoes who maybe you do disagree with, to understand their perspective and offer them help in whatever life circumstance that they may present? That's all.
Oh, thanks, Jessica, so much. Are the other hands that are raised, are they ones that were left over or that I didn't call on? I'm losing track. Is there anyone else who wanted to have a last word?
I do have a quick note, Doug, if that's okay.
Yeah, sure, Luke. Thank you very much.
So I obviously I work with Doug and I work with some of the other teams in Braver Angels doing these debates in different scales and different levels and on different sorts of topics. And every single one of them, I always come out of it, number one, refreshed and like glad that we can do civil discourse and glad that people love each other and all that kind of thing. But I also, I read a lot of history, right? American history, just for its own weird sake and for understanding the world around me is just one of the things that I absolutely love and am in love with. And the thing I think a lot of people don't realize about American history is that there's a lot of diverse political traditions in it, right? More than you would normally think, just from a cursory look at it. And whenever I either staff one of these debates or participate in one of these debates and just am sitting in rooms with my fellow Americans from all over this broad land, all over the chorus of the Union, I see in the opinions expressed, in the temperaments that people have, in the ways people express themselves, that huge hearth and variety of opinions and ways of thinking about things and distinct traditions, distinct ways of life and ways of looking at it, that you can see all the way all over the American political tradition in every era of our history, in every pocket of our country, and traditions which I'm sure will be still with us in this great conversation that is America for many decades and centuries to come. And so it's always kind of a powerful and humbling thing to be in these debates, because in some sense it is like American citizens getting together and talking about issues that are important to us. But in other sense, it's almost a kind of a continuing reenactment of a conversation that has happened among Americans every generation, of all backgrounds, of all dispensations, in different ways in different times, but will continue happening, and we're just pushing that conversation along. And so Doug was an excellent chair tonight in helping facilitate that, but you were all excellent participants tonight in showing what free people can do together when they have a commitment to real deep things on this front, you know, even when they don't agree on what those are, but as long as they have a spirit of charity and goodwill to come with each other and learn from each other. And so I'm always just honored to be in this. And Doug, thank you for having been an excellent host on this front too.
Thank you so much for adding to the evening and adding so much energy. Really appreciate that. So we're about to call it a night. Brent, your hand is up. Is that just like leftover hand?
I think I left it over. Sorry, but just I'll make a quick statement and then I'll tell you what I like about what happened tonight. I just realized too, just that it's not like a political thing where it's one person against another and we're constantly trying to come up with an answer with the topic. Everybody made a statement and we just had questions. I like that much better. So that was a good way of doing it.
Well, and we thank you very much. All of us thank you for contributing so much to the evening. You really added tonight.
I'm very involved in things. That's why I'm like, I don't want to overstep, but.
Well, great. So I get the last word, and it's really just a request. You know, I put my email in the chat, and I also would like Alicia and Diane to put their emails in the chat, because so many students are connected with these two faculty members of the colleges we work with. I got 100 emails or 110 emails from people who registered, and about 90 showed up. It's a lot of people who showed up tonight. I'm going to ask students, write your professors when you have a little time and when the dust settles, write a couple of sentences to your professors about what this evening was like for you. It really helps us because we have to go out and promote this to different colleges who know nothing about it. The best way I found to do this is really through student voices themselves. They're, you know, they're on the wavelength of other students, and faculty are on the wavelength of other faculty. So, you know, my ask is just the testimonial effect of, you know, what you experience, put it into a few words and email it to somebody, either myself or Diane or Alicia. And I can't thank you enough for spending all this time with us. It's already almost 10 o'clock Eastern time. I think we did good, you know? So that's all I want to say. And I'll just leave it to Jessica, Alicia, and Diane if you want to wrap up. If not, then I move that we all have a great night. And
Thank you everyone for coming out.
It's a great evening of civility. Thank you.
Yes.
thanks to
Thank
Allegany.
you, everybody.
All right, good night, everybody.
Night.
Okay, good night.
Thank you.
Bye-bye.
Bye.
Good job. Thank you.